and friends from across the animal health and veterinary sciences and community who have joined for this national workshop on World Veterinary Day. It is indeed an honor that I, on behalf of the Department of Animal Husbandry and Dairying, Ministry of Fisheries, Animal Husbandry and Dairying, welcome you all to this national workshop. So initially, we'll be starting with a technical session, and then there will be the validity or concluding session where our Honorable Minister of State will be joining for this occasion. Our father of the nation, Mahatma Gandhi ji, had quoted, "The greatness of a nation and its moral progress can be judged by the way its animals are treated." So here the role of veterinarian comes very important. The veterinarians are responsible for dealing with disease control, disease surveillance, food safety, when we think of productivity enhancement, breed improvement, and when we think of welfare. So here the role of veterinarian is very important. So keeping in view, the World Veterinary Association has declared that the last Saturday of April of every year is declared as the World Veterinary Day. And this year for 2025, the theme is Animal Health Takes a Team. So keeping in view, we will be starting our technical session. So now we begin our technical session, which brings together experts to share insights on veterinary public health, disease prevention, and use of veterinary tools for a healthier future. So for this technical session, I would like to invite our guests. So our co-chairs for the session, that is Major General Devendra Kumar sir, who is the Director General for Renowned Veterinary Services, Indian Army. Sir, kindly have a seat. Our co-chair for the session is also Dr. Raghavendra Bhatta sir, who is the Deputy Director General, Animal Sciences of ICR, New Delhi. Please, sir. Next, I would like to invite our speakers for this technical session. Our speaker is Sir Sri Ramasankar Sinha sir, Additional Secretary, Livestock Health. Sir, kindly. Next speaker for this technical session is Dr. Chakradhar Toz, who is the Principal Scientist, as well as sir is the OI expert on avian influenza. Kindly, sir. Then I would like to request the chairman of this main event, Animal Husbandry Commissioner, sir. Sir, Sanket sir. Then I would like to request the rapporteur of this technical session, Dr. R.G. Bambal sir, who is the Secretary, Veterinary Council of India, to kindly have it. Our speaker, Dr. Sanket Kulkarni sir, is on the way, so he'll be reaching very soon. So we'll invite him. So starting the technical session, we'll start with a very interesting topic. That is, very recently, the cabinet has approved the use of generic medicine in the veterinary sector, that is Pashu Jan Aushadhi. And so I'd like to welcome all the veterinarians and the delegates who have arrived from the different parts of the country, starting from Ladakh to Karnataka, and across from Arunachal Pradesh to Gujarat. So welcome you all to this very important event, that is World Veterinary Day, which we celebrate for our contribution that we do to the humanity. And we extend a warm welcome to our dignitaries as well as the speakers who have joined for this technical session.
Very warm good morning to all of you. Namaskar. First of all, let me congratulate each one of you on this momentous day of World Veterinary Day on 2025. I have with me Dr. Bhatta, DDG Animal Science, DG RVC, Dr. Devendra Kumar, my colleague from the headquarters, Mr. Sina, Additional Secretary, my friend Dr. Tosh, with whom we were together for a quite long time, PCI Secretary Bambleji, and Adiraj, Dr. Adiraj from our cell, all dignitaries, all my fellow veterinarians from the different part of the country, esteemed other professionals, ladies and gentlemen. This year theme in World Veterinary Day is it takes a team. So it reminds us that veterinary profession is a profession which does not work in solo mode. We have to work as a concert, in work with, of course, veterinary professional, paraprofessionals, community health worker, human health worker, epidemiologists, then policy makers, drug manufacturers, pharmacists, animal welfare experts, trade experts, and you can name anybody. I think we touched. I was talking to a forum in an inaugural session of World Health Summit in Bharat Mandapam yesterday. That we touch each and every aspect of life, and which is very evident from the 19 SDGs we have, the 17 SDGs we have of UN. 9 belong to, we touch the animal husbandry sector. We'll be speaking more, I'll be speaking more when Honorable Minister comes and in his presence. But at this time, I again welcome each one of you to this celebration of World Veterinary Day. And I know that each one of you are very busy, and many a time ministry is inviting, particularly from the state people, we always request you to come, and you always come to us, and sometimes we become so close, one invitation or another, sometimes it is so difficult for you to come all the way, but still all those university vice chancellor, deans, your secretaries, principal secretaries, veterinary directorate, who have come personally as well as who have sent their representative, and particularly veterinary students, let us celebrate this day, momentous days of World Veterinary Day, and let us feel proud that as a veterinarian, we are the silent sentinel worker who guard the nation in a different perspective. And we work with the patients. I was referring this thing to my lecture in last day, that we treat a patient who cannot talk back, but they can bite often. Many times they can bite back. Sometimes they poof on your shoes, right? Generally, in general term, if it happens with any other scenario, then you will not like to treat those people or treat those individuals. But our profession is such, in spite of the bite and the spoofing and all those hazards, we happily treat all those creatures other than human being. I still remember today that our former Minister Rupalaji used to tell, I am so happy to lead this department, because this department belongs to all creature except human being. So I have a much more bigger portfolio than anybody is having. So with that, we'll be listening to the lectures. We have got 3 great speakers, and then we have a brief session with the Honorable Minister. I am also hoping that our Secretary, Ma'am Alka ji, may join from USA. She is traveling there. So, and we will be also joined by FAO Chief Veterinary Officer and Additional Director General, Dr. Thanawat. He promised that he will be joining from FAO Rome and deliver an address. With this, again, I welcome each one of you and thank you for coming in number. And all the speakers and dignitaries in the stage. I also welcome you and thank you for accepting our invitation. Jai Hind, Jai Bharat. I'll be coming back again. Thank you.
Thank you so much, sir. So continuing with our technical session, I would like to request our respected Additional Secretary, sir, Additional Secretary Livestock Health, Sri Ramshankar Sinha, sir, to give us a few insight about the use of generic medicine in veterinary sector. Sir, please.
Very good morning to all of you, respected or distinguished persons on the chair, on the dais, and all the dignitaries from various states, institutions present here. First, let me congratulate you all on this very special day. On World Veterinary Day, we are celebrating today, and also the theme is also very interesting. Animal health takes a team. So as our Animal Husbandry Commissioner Dr. Abhijit Mitra Sahab said, that the role of each institutions, each segments of veterinary sector is very, very important. And that is why this theme is also important. And it happens to me that since I'm looking after livestock health, and almost 6 months I have done, then I have also developed some insight into the things. Before this topic, I will start, that is use of generic medicine in animal husbandry sector. I must say that it is very, very important segment, though directly it doesn't appear to be, but it is very important that health is very, very important. And animal health, you can show the next slide. Animal health is important from the point of view of productivity. We all know that, but it is, we say, it can be said that it is not discernible, that health part, how health is working. But, and it is not discernible to common man. Obviously, when we study and then we know that how each disease affects the productivity, then we know. But as generally we think that, okay, this is a small, some disease, what will happen and all. But this affects productivity because here all of us are from the veterinary sector, so we know that this is very, very crucial aspect for productivity. And then quality of the product also, because we know that livestock product, that is, the demand is going to increase day by day. It is increasing in some of the sectors, some of the sub-sector we can say of livestock sector, like we have already achieved the like in milk production, we are the highest. So now from here where, that in that we have this health part is very, very crucial. And then other things which new issues which is coming up is that AMR and One Health, everything. So the health is overall, we can say that this is a threading factor for all these things. And it is very, very, very important. Now, our livestock sector, if we look at it from the angle of where it is being reared and all, then we know that majority of it takes place in the rural areas and villages. and that too by the marginal farmers or low income groups, and their income is connected, livelihood is almost connected to this. So health becomes doubly important. So from all these things in mind, it was like this time it has been thought of when we were revising LSDCP scheme, which is for vaccination. Then one Pashu Aushadhi component has been added. And Pashu Aushadhi component, that is basically it is that to sell, make arrangement for availability of generic veterinary medicine in the rural area. And so this is from there, we have we are planning, that has been approved, and that we have to make available through PM Kisan Samriddhi Kendra and also cooperative societies. So we know that how our this network of cooperative society and Kisan Samriddhi Kendra, PM Kisan Samriddhi Kendra, how important role these organizations are playing as far as agriculture and livestock sector is concerned. So this Pashu Aushadhi Kendra, that will be the selling point of generic medicine, generic veterinary medicine. And since Jan Aushadhi Kendra is also in parallel for human and that is also generic medicine, there is a available that Jan Aushadhi Kendra, through Jan Aushadhi Kendra we are making available that generic medicine. So on similar pattern it is there. So we have this PMBI, Pharmaceutical and Medicine Bureau of India, Medicine Devices, Medical Devices Bureau of India, of Department of Pharmaceutical, and they are operating there. So we will also be through them, they will be playing a crucial role. And then since it is we have to make available through PM Kisan Kendra and cooperative society, so we will be taking help of Ministry of Cooperation, then Ministry of Panchayat also. So this way the draft guidelines have already we have prepared, but it is under circulation, and soon we will be releasing this. So this will help in generating the employment also in rural area, and then this will make available the generic veterinary medicines in the rural area. Why we say that generic veterinary medicine, what is great about this? So I think all of us must be knowing, but still for the sake of understanding of all of us at one plane, I must just repeat it that generic medicine is nothing. It is any medicine which has been invented or manufactured new after due research and all. But whenever a company or any research organization does that, comes up with a new medicine, then they are given a patent of the medicine for some time. So during that period, it is called branded. And after that, the same medicine, same composition, I mean active ingredients within that medicine, retaining that same standard, same utility. After that patent period is over, it becomes generic. Any manufacturer can manufacture that, and that is why the rate goes down substantially. I was discussing with one of our colleague who is doctor in veterinary sector. He said that the price goes substantially down, like mastitis disease is there, and which affects the productivity, and the branded medicine is very costly. But when, and any farmer, and as I said that large number of marginal and very poor people are also engaged in this sector whose livelihood is linked. So if the medicine is very costly, where from they will go get it? They have to take loan even for the medicine. So that price of the medicine will go down substantially. And that will facilitate easy access, and they will use also. So that way they can control and they can arrest the decrease, any possibility of a decrease in productivity. So that is important aspect about generic medicine. So lower cost is there, and quality check is same. There is no sacrifice in the quality check. Quality check is done. Only thing is that the after patent period here, that is my understanding. So if there is any correction, someone can correct it also, but that is what I have understood about the generic medicine, that after a patent period it becomes generic, and the rate goes down, and the quality is same, cost is down, and that is we are trying to facilitate that availability for the rural people. Initially, we have thought of that 50 type of medicines we will make available. For that, we have a technical team which will decide about the medicine. And then through PMBI, we will make it available. And any entrepreneur who is having the degree to run the shop can have the license, approach through PMKSK and Cooperative Society, apply, get them registered, and then we can facilitate, then medicine can be supplied, and definitely if we are having an organized channel, then they will have some advantage also of that. So those all things are being worked out. Soon it will be released, and I think it should have a very good impact. Very good impact. We are trying to make it as positive as possible, so that people can come forward and open it. And then I will request you also that actively try to explore it, the possibility of opening the outlet through PMKSK and Cooperative Society for Pashu Aushadhi Kendra, and we will be supporting in whatever manner the draft guidelines we have formulated, and according to the guidelines, we will be supporting you. So thanks a lot for listening me patiently. Thanks. Thank you.
Thank you, sir, for your valuable perspective and for highlighting the potential of generic medicines and ensuring affordable and accessible use in the veterinary healthcare. Thank you, sir. Now we have with us our third speaker also, Dr. Sanket sir has reached, so we give him a warm welcome, sir. So moving ahead with the presentation, now I request Dr. Chakradhar Tos, sir, who is the principal scientist, ICR Nishad, as well as the OA expert on avian influenza. So he'll be giving a presentation on role of veterinarians in preventing zoonotic transmission of avian influenza. Thank you.
Good morning to all of you. Namaskar. Dignitaries on the dais and off the dais, officers from state departments, welcome to my presentation. And I take this opportunity to thank the department for this opportunity, and also all the veterinarians present here. You may not be knowing how you have contributed to my presentations, which will be form a part of my presentation. And also, I will take this opportunity to interact with you, because I was not knowing how this program will run. So since you have come from the departments and also from the state laboratories, In between my presentations, I will have some interaction with you and how to improve the animal health surveillance system in India, including specifically to the avian influenza, because I am dealing with avian influenza, so that we can have a better effective animal health or avian influenza surveillance system which can contribute to the national economy and also safeguard the animal and human health, because it is again a zoonotic disease, as you know it already. So coming to the my presentation, this is avian influenza or the bird flu, as you know. This is a transboundary animal disease, meaning it spreads very rapidly, highly infectious and spreads rapidly. If it is not controlled or attained, it becomes endemic or it entrenches the poultry population. And it has huge economic impact, also international trade impact also. And in low and middle income countries, it affects also livelihood of the farmers or the poultry farmers or the owners. And this will be my presentation's content. I will give some introduction about the flu, then Indian scenario, different, what is the current situation, the past, and then the control and containment measures taken, and what is the strength and the weaknesses, and then the global scenarios, the control measures, and then the roles of veterinarians, which is very important, that also I will highlight. It may not be complete, but I have divided in different portions how the veterinarians in different stages, they contribute to the control and containment of the avian influenza. So as you know, this disease is primarily a disease of birds, poultry, specifically the meat-producing birds like chickens, dogs, turkeys, or guinea fowls. And also it affects pets and a large number of wild birds. Maybe more than 100 species of wild birds are affected with this disease globally. But recently it has spilled over to mammals in the land mammals and also the sea mammals. And also some intermittently it has jumped or spilled over to humans. Globally, more than 24 countries has reported human infections and also mortalities or the death in humans due to this high path AI, specifically a specific strain of avian influenza, the H5 strain, which is currently circulating, that is also jumping to humans and causing deaths. And there are two different forms of the disease. One is low pathogenic avian influenza, that there is production losses and it is a self-limiting disease, specifically affecting the respiratory or the digestive tract and does not cause a systemic infection, but there is huge loss of production due to this disease. As per the industry, poultry industry, there is more than 6,000 crores loss per annum due to this low path AI, specifically the H9N2 low path AI. And there is a high pathogenic form, which is in laboratory settings, it kills 100% of the poultry within 48 hours. And it becomes systemic, and this virus, certain strain of high pathogenic avian influenza, now currently spreading, including all the continents. Even it has gone to the Antarctica also, to the wild mammals. And this is caused by a type A influenza, just a little bit of science, and it has multiple, since it mutates very rapidly, it has multiple subtypes, maybe H1 to H18 and N1 to N11. With the combination, it has theoretical more than 150 subtypes, like H5N1 or H7N2, N9 or H9N2. And the wild birds, specifically the water birds, the dogs, geese or shore birds or these gulls, they act as a reservoir where they stay as a low pathogenic form which does not cause any disease or no clinical signs, but they act as a carrier of this virus. And once this virus jumps to poultry or domestic poultry in chickens or turkeys, some of the strains, they adapt and then they mutate to form a high path AI. This low path AI, when there is interaction of wild birds having the virus low pathogenic form with the poultry, domestic poultry, and then adaptation, that becomes a high pathogenic form. And it is spreading now, again jumping back into the wild birds and spreading globally and through bird migration during winter seasons. You must have seen a lot of outbreaks during the bird migration season because you know there are two times there is a lot of bird migrating from north-south direction, then they're going back to the north during February or March. And during that period, we have globally and also in India, we have seen a lot of high path AI outbreaks in poultry, and some wild bird detection has been seen. And also, there is also, this virus spreads through bird migration, also through international trade of poultry or poultry products, and also through the travels. People may be carrying some products through which the virus also travels. And in India, this also there is due to some informal trades across the borders, because we have a lot of land borders with the neighboring countries. So there may be a lot of informal trades may be going on, through which, because we have seen there are similar viruses circulating across the borders. So that could be one of the reasons. The informal trades across the borders could be one of the reasons which helps in the spread of the disease. This is the situation, current situation since December 2024 till March. We have seen outbreaks in 8 states, the poultry outbreaks in 8 states, including Bihar, Jharkhand, and then the Madhya Pradesh, Karnataka, Chhattisgarh, Maharashtra, then Telangana and Andhra Pradesh, poultry outbreaks. More than 30 outbreaks has been reported in poultry during January to March. And also this time we have seen outbreaks in wild birds also in Rajasthan and also Maharashtra and other states. But interestingly, this year we have reported the virus jumping, spilling over to the wild birds, the tigers and the leopards in one of the wildlife rescue centers in Gorewada, Nagpur, where 3 tigers, Royal Bengal tigers and 1 leopard died, and they are tested positive for high path AI. They are highly pathogenic for avian influenza, and they are very related to the viruses circulating in domestic poultry in this region, specifically in the South Asia region or the SAARC regions. And also there are 2 incidents of the high path AI detection in one of the domestic cats and also jungle cats in Madhya Pradesh and in Goa. That is the wild cats. And we have characterized these viruses. Specifically, we have gone to the areas where the cats died and also collected the samples from the poultry, the cats. This virus, when characterized, these viruses are very similar. The poultry viruses are similar to the cat viruses, and we have interacted. Because specifically you must have seen when you go to a poultry market for your fresh chickens and other things, some people, they carry the offals from the poultry. So we inquired it. So they purchase these offals for their pets, specifically the dogs and the pets, the cats. So that is one of the reasons how this virus spreads from the poultry to the pet animals, and also, and in tigers and leopards, that also we have gone for a investigation on this. They are feeding the cats 8 kilo of meat. 6 kilo is from chicken source and 2 kilo is from the beef or the buffalo source. So these are the one of the sources how this virus could be spreading from the viruses prevailing in poultry to the wild cats. And coming to the outbreaks, it is not that only the India is reporting. There are a lot of outbreaks reported in neighboring countries, including Bangladesh, Bhutan, and China and Nepal. They are also reporting the outbreaks continuously since 2006. This is some of the outbreaks which are already resolved outbreaks in South Asia and the neighboring countries. More than 1,500 outbreaks in wild birds or the poultry has been detected in this region This is one of the worst affected region globally, where a lot of outbreaks has been reported and huge number of poultry death has been reported or called to control this disease. And in India has reported more than 400 HPI outbreaks in poultry and also wild birds due to this virus in 25 states and union territories since 2006 till August 2024. So this is and there are also human fatalities has been reported in neighboring countries like the Nepal or the Bangladesh and Pakistan also, and India has reported this year also one human case which was fatal case in Andhra Pradesh, a 2-year-old girl from which the virus was detected, and also earlier in 2021 also there is a human case, fatal human case has been reported, and the H5N1 virus has been isolated from a boy. So since last year March, there was the virus jumping to the dairy cattle. That is the first time in history. The virus was isolated from dairy animals in USA. So considering that also, we have screened the dairy animals in outbreak areas, the outbreak epicenters in 1 kilometer radius in different states like Kerala and Odisha. After the sanitation certificate is issued, we have collected the samples and tested in different epicenters, like in Kerala 6 epicenters and Odisha also 4 epicenters, and different species like the cattle, buffaloes and goats, and we collected the milk and swab samples. They all tested negative. This is a reaction to the outbreaks in dairy cattle, whether there is any spillover from poultry to cattle, we have screened. This is the characteristics of the viruses circulating in India since 2006. There are different viruses circulating. In 2006 to 2010, there are different viruses. And interestingly, if you see 2011 to 25, there is one virus which is persisting since 2011 to 2025. And that is genetically called 2321A clade. That means the virus is still persisting in this region, including India, Bangladesh, in the SAARC country, including India. And that is a dominant strain still. It is being detected in the current outbreaks also since 2011. And there are different strains or clades. They also isolated in between and they have disappeared. And the current strains, they are 2344B, which is a minor clade of virus which is detected only in wild birds. But the dominant virus in all the 8 outbreak areas in outbreak states, they are of 2321A viruses. And all these viruses we have seen antigenically, they don't cross-react with each other, that indicating that a vaccine formulation with one clade or one genetic lineage may not give a cross-protection to other viruses. So that means you should have a multiple vaccine strains, candidate strains, and also you should know which virus is circulating in which parts of this country. So what is the country's preparedness for this avian influenza? We have a law or the act on which we work on the control and containment of avian influenzas. There is an action plan which was formulated in 2005 and then modified subsequently in different years depending on the experiences gained from the outbreaks in field situations. Then we have a laboratory network. We have 6 RDDLs and CDL. There are also other laboratories coming up to strengthen because we have a huge geography, and testing the samples or the collection of data from the field, it may not accommodate in the 6 regional disease diagnostic laboratories. So few other laboratories also, they are coming up to test the samples, preliminary samples in the regional level. And then we have a previous pathway evaluation, and it was OI submitted in 2018. We have the strength and weaknesses they have given, and they have also given the recommendations how to improve the weaknesses so that we have a better animal health surveillance system, or the infrastructure, the manpower, so we can strengthen so that we have a better surveillance system and to address all these animal health issues. And recently we have also an animal avian influenza simulation exercise, that is avian influenza outbreak and response simulation exercise, that also has given recommendations how to strengthen the capacity of the laboratories and different systems so that we can effectively address the avian influenza in the country. Then we have since we know that this is a zoonotic disease which jumps from poultry to the humans, so we have also a national joint outbreak response team as a One Health mission, where the veterinarians, the wildlife experts, the public health experts, they form a team and visit to the outbreak areas and to collect the data how this virus spreads or the prevalence of this virus, so that we can effectively manage the One Health issue the virus poses and it jumps to humans. And also we have a One Health mission we have in India. This is how we have to interact, how this information flows from field condition till the reporting of the disease. And you know, you play a major role in the collection of data and then centralization of the data to higher level. And the quality of data you collect from the field, that plays an important role, and that also indicates how effectively we manage the disease in our country. And quality of data and how you transport, because we have seen, as a laboratory we have seen, though there is a uniform policy document, even national action plan, but still we get lot of samples of the data in different conditions. Some people sending samples in a pony bag, and when it reaches the laboratory, it is already putrefied, smelling like anything, and sometimes without a information what the vials it contains, whether it is a poultry sample, from which state, when it was collected, what is the type of sample. So I thought I will take this opportunity to interact with you so that at least whenever the samples are collected, please follow the national action plan, so that since the samples we receive, we have to test it. Of course, many times we have communicated to the states that sometimes the samples are unfit for processing. Because if the samples are properly not submitted, and if you get a false negative, yes, you will be happy that yes, we don't have the virus circulating, but the virus may be spreading silently and causing the disease. And that's why I highlighted that there is a persistence of the virus 2321A H5N1 virus since 2011. So I'll take this opportunity to request all the departments, laboratory personnel, those who are directly or indirectly under their field functionaries, collect the samples. Please see the national action plan for submission of the data to the next laboratory for the testing and interpretation of the data. A false negative is not a good indication or a good sign, happy situation. And then this, as you know, this is the way how the samples flow to the laboratories, from the state laboratories to the RDDLs, regional disease diagnostic laboratories. Then they test the samples. If the samples comes positive, then with the samples and the result, the samples are submitted to the National Reference Laboratory for confirmation and submission of the results to the departments, based on which the actions are taken, and you all know how these actions at the state level or the epicenter level is carried out. This is the strategy now followed as per the NAP, National Action Plan. We have a detection and calling policy. We test it and then call.
just थोड़ा फास्ट कर दीजिए. हाँ, and you can wrap it up.
Okay,
in
I
15
will
minutes.
complete quickly.
कितने slide है अभी आपका?
Or maybe I have total 20 slides, so I will complete. It is,
Yeah,
I think I'm good.
Maybe I think the most important thing is जो prevention and control वाला है.
Yes.
I think veterinarians will be most interested. Highlight करके you can.
Yes. So this is the policy we are now following. This is a detection and culling policy for all the controlling the diseases, outbreaks, and the in-contact poultry also within a 1 kilometer area, we call it, and then we give the compensation to the forced culling of the birds for the farmers, and also then we dispose it, sanitize it, issue the sanitary certificates. Then we have restriction of the animal movement. That is very important. Overnight, sometimes the people know that the sample is submitted to the NISA. If it is high pathogenic, naturally they know there is high mortality, and the overnight samples, the birds are, maybe 5,000 birds has gone overnight, there is no birds. That does not, that is not a happy situation. That through that transport of the samples, we are spreading the viruses and also interacting with the viruses. And then we have the biosecurity practices, and then following the sanitary certification, we have the post-operative surveillance, which is carried out every fortnightly, that is taken up to 2 months it takes, and then we don't have a vaccination policies. This is how we are supporting the pandemic preparedness of this disease, because we know this is a zoonotic disease which jumps to humans. As a global pandemic preparedness, India is contributing to WHO vaccine composition meetings through a flu network. Whatever the viruses circulating in this region is shared with WHO through a flu network. And so far we have shared more than 100 viruses since 2010. And they compile the viruses sequences, and they advise the national authorities which strain is suitable for this geographical region, and it is the national authority which takes up these vaccines, formulation of the vaccines for its populations. This is the global scenario. It is except the Oceania, that is almost all the continents are affected with high path avian influenza, including the Antarctica. You can see the India, then Europe, South America, North America, and this is the situation. It is also increasing the wildlife and also affecting biodiversity. And this is the dominant virus globally available 2344B, but locally there are certain strains, like I told, that's in South Asia, including India, Bangladesh. This is one of the strains still persisting since 2011. And in also Southeast Asia, there is also 2321C virus. These are all genetically and also antigenically different from each other. And recently, in last year also, there is a virus jumping from poultry to the cattle, and also subsequently there is jumping from the poultry to the sheep in the United Kingdom, in UK. And earlier it was thought there is a single introduction from a wild bird, but subsequently different viruses were isolated, and it was found that multiple introductions to these wild birds to the domestic cattle was there. And the virus spreads very rapidly because there is a lot of animal movements from one farm to other farms. So these are the number of reports, dairy herds infected in 17 states, and there is lot of mammalian infections has been reported, more than 48 mammals, including the sea lions, sea elephants, red foxes, cats, minks, and recently tigers and leopards has been reported. And they have taken this, the measures how to control the disease in dairy animals, segregating from the infected to the healthy ones. Then they are testing the milk samples, so that no milk goes to the public infected milk. Then they have a lot of biosecurity practices, how to separate the infected and does not mix with the healthy herds. And then they have a lot of vaccine strains trials undergoing, though they don't have vaccination policy, don't vaccinate to control this disease, but they have the vaccination policy for any untoward situation, for future requirements. And also they are pasteurizing and destroying this virus or diverting this milk samples from the infected animals so that does not mix with the healthy milk samples. This is the global scenario, how this virus is controlled globally. Historically, the same way, they remove the infected flocks by culling the in-contact flocks, and then they have practiced the biosecurity practices so that the virus does not spread to the farms, then continuing the diagnostic and surveillance, movement restrictions, and educating the farmers. Yes, vaccination is an additional layer, but vaccination is not the only solution. With vaccination, all these control measures has to be followed, then only an effective control policy can be evolved, or only vaccination is not going to solve the purpose. It will aggravate the purpose, because when you vaccinate the poultry, it will just subside the clinical symptoms of mortality or the clinical signs. But the virus will be circulating and it will be interacting with the humans, and a day comes where it adapts to the humans, and since it has a pandemic potential, you never know. So the vaccination is not only going to solve the purpose of controlling the disease. These are number of the human infections reported, different regions, more than 2,500 human infections with different diseases. 50% of the human cases are fatals. And this is the public health risk analysis by WHO, FAO, and OA. And the public health risk due to this currently circulating H5 virus is low, at low level. However, those who are occupationally exposed, they may have low to moderate, depending on the measures or the protection practices they follow. And since 2007, there is no human-to-human transmission has not been reported. But earlier to 2007, there is human-to-human transmission has been reported in some of the clusters, or in healthcare workers, those who are treating the patients, and those who are exposed to they are high risk. And this is the role of the veterinarians. I have tried to compile, there may not be not limited to this. From the field level till the central veterinary services, from the field level, you have the sample collection or the data collection from the live bird markets, fields, and then from the border posts. So this is the very critical, important for the data collection, how the disease is behaving. And then we have the different state laboratories, how the decentralization of the data. Then we have the laboratory at the region level, at the central laboratories, and at the national veterinary services. These are the roles. This may not be restricted to this, but they play a major role in, yes, sir, just 2 minutes. Surveillance, early detection, and rapid response. Yes. So I want to conclude, like highly pathogenic avian influenza is not going to, is very difficult to eradicate in near future. It will stay for certain times with us. So therefore, the effective avian influenza surveillance or the animal health surveillance, monitoring and rapid response is the cornerstone of disease control that enhances the contribution of veterinary services to the national economy, food security, public health safeguard. So I just like to acknowledge my colleagues, the director, the ICR, Department of Animal Husbandry, and the state, all the state animal husbandry and the veterinarians, those who have played a critical role, and their data I have part of my presentation also. So thank you very much.
Thank you, Dr. Tosh. It's a very happy situation that our Honorable Secretary, Alka Upadhyay ma'am, has joined online with us. Ma'am, welcome to you. I think you can hear us. Ma'am?
Yes, I can hear you all.
Yeah, welcome, ma'am. Namaskar. It shows your attachment and your commitment for the department and for the veterinarian of the country. That you have, I think it is a very odd time for you. It's almost 11:30 night, and you took our request and you joined online. Without spending more time, just to let me know you, ma'am, we have got more than 200 people who have physically joined from 14 states. And we also have some online participants, but most of the online participants, I guess they will be joining around 1. but it's a 200 people, odd people gathering. Now, without making more time in between, I will make a request to you to address the veterinarian of the country on this World Veterinary Day. Over to you, ma'am. Thank you.
Thank you very much, Dr. Mitra. And so, good morning to all of you. I welcome you all to this World Veterinary Day celebration that we are doing today. And being the chief administrator for this particular subject and this department, I couldn't have not attended this conclave or meeting. So Dr. Bhatta, Dr. Devendra Kumar, DG RBC, Mr. Sinha, our Additional Secretary, Dr. Sanket, JD NCDC, and Dr. Mambal, Secretary BCI, and all the officials of the ministry and officers from the rest of the country who have joined us, wishing you all a very happy Veterinarians Day. Indeed, this is an area which is growing leaps and bounds. We all know the relevance of the livestock sector in the country. We have been talking about it for a very long time as how the livestock sector is helping growth in the rural economy. And I always mention this, that this is a very significant contributor to the women's empowerment, as this gives a lot of income to the women in their hands in the form of cash income on a daily basis. So it is proving to be of great use and as a boon to all the women and the other agriculture farmers in the country. I will talk about the importance of livestock sector a little later. But today being the World Veterinary Day, I would also like to compliment each one of you who's doing yeoman service in this field and who have contributed in a very big way in increasing the productivity in this country, which is today leading the world in several aspects. We are the dairy of the world. We are first in terms of dairy production in the world. We are second largest producer of table eggs, next only to China. We are fourth largest meat producers and also exporting a lot of meat to many countries of the world. And of course, there are several other things that we are doing. We have become totally reliant or Atmanirbhar. We do not depend on any external countries or foreign countries for any kind of contribution in the livestock sector. Be it the advanced technology like IVF, sex sorted semen, dairy production, equipments under the dairy manufacturing sector, whether be it the immunization or the vaccines for the dairy sector. So a lot of effort has gone, and this could not have happened without the uh, presence of, without the contribution of each one of you who is present here in this room. However, I also feel at this point in time that a lot more has to be done, and practically, I would say it needs a total shake-up and a total change now. The way the veterinary services is looked at has to change, or the way the dairy or livestock sector is looked at needs to be changed. We need to know how important it is for the contribution of this sector, that the veterinarians contribute a lot. I also recognize the fact that while there are a number of veterinarians working with us in the field areas, but there is an acute shortage. We started the mobile veterinary unit, and I hear this from state after state. I recently visited Jharkhand, and the common thread that is coming out is that we are short of veterinarians, and we are not able to place as many veterinarians for the mobile veterinary unit. And this, in fact, comes from resonates from a lot of states. So we have to, number one, create more seats. Currently, we produce about 5,000 veterinary doctors every year. I guess this is insufficient. We always hear in the budget speech that so many number of seats have been added on the human health side or the on the veterinary on the medical admissions. But when it comes to the veterinary side or animal sciences, we see that there has been a stagnation. In fact, when there was RKVY, we used to get a lot of funds, and many of the state governments were able to create their own veterinary colleges. However, now with the RKVY funding not being available with the department, the private colleges have now come up, and we have about 70 to 72 such private colleges. In fact, it's a good model of public private partnership. The only thing I would urge over here that those who are involved in veterinary education should also take it seriously. They should also have state of the art facilities for the doctors who are going to become veterinarians tomorrow to be taught in a proper fashion, to be taught relevant courses, and they be given enough expertise to handle operations, to handle different kinds of surgeries, different kind of medical treatments to the our livestock. For this, it is important that these public-private partnership public colleges have a certain sense of ethics, and they come up with the best of the teachers, they come up with the best of infrastructure. We are committed towards providing quality education. In fact, what is also important is to provide continuing education. We are falling short of that. If all of you in the room recall that on the medical side there are various kind of conferences around the year, but I do not know if we have any such conference or platform available for these kind of courses around in the country. Recently took a decision that in order to improve productivity, we need to do more of IVF cases so that the progeny is from the best of the mother and from the best of the bull. But the tragedy is that ever since the Rajiv Gandhi, the Rashtriya Gokul Mission has started, we have been able to have very little success on it, or very few embryo transfers have happened. There is expertise in nooks and corners. We need to replicate this expertise all across the country. For this matter, we have decided that we will have a conference where we will call the veterinarians and the experts in this area who can talk about the possible techniques, who can talk about higher success rates. Similarly, I think in many other areas also, and there could be many, I'm not a veterinarian, so I would not be able to pinpoint, but I'm sure there are several other areas in which we need to have this continuing education concept with us so that the doctors are constantly updated with the latest developments and the techniques. This is true. Number three, I also urge from this platform that the doctors who are in the field are also provided good infrastructure. So having a doctor itself is not enough, but having a good infrastructure will also be important. We need to have good quality labs. We need to have a network of laboratories. We need to have NABL accredited laboratories. I have been emphasizing upon this point that if it is important for the human side to have these laboratories as NABL accredited, why should the veterinary labs not be of the same standard? We all know the growing danger of zoonotic diseases, and in order to control the zoonotic diseases which arise from the animals, we need to have a very strong surveillance mechanism also. I'm very happy to see that Nivedi has been constantly working in this field, and they have come up with a very good surveillance plan. Now it is up to the states to adopt those surveillance plans, have the collection mechanism in place, have sincerity, I would say, over and above everything else, have sincerity to do so. We have taken a distant stride, not a distant stride, but a bold stride to declare some of these states in the country as FMD free zones. In the first phase, we are talking about 9 FMD free zones. for which a lot of work has happened, a lot of micro monitoring is being done. This dream will not be possible if we do not do micro monitoring, do not have a synchronized vaccination campaign across all these 9 states, which are mostly the southern states and Gujarat. So there is a lot of work that has to be done. It cannot be done without the help of the veterinarians. It cannot be done without their sincere involvement. Uh, Besides dairy sector, I think it is very important to also look at the smaller units. We have not been able to do much, but Dr. Mitra, who's the AHC, he always says this, and I totally adhere to what he's saying, that there is a lot of scope as far as goat meat is concerned. We are seeing that the prices of the goat meat it's increased exponentially. I think somebody's mic is on. Can you please switch off the mic? Dr. Atulya, I think you're, now it's fine. Yeah. So I totally agree with you on that. There is a lot of scope in going for good progeny of the goats, sheep, pigs. In our country, we have suffered from the African swine fever. And in the Northeast, there has been a terrible loss of piggery population. The livestock production system revolved mainly around pigs, but we saw a lot of decline in the pig population in this area because of the ASF outbreak. This ASF has to be controlled. I was just speaking to my colleagues on last working day, and they said there is no vaccination for ASF. The only thing available with us is the biosecurity measures. I think an increased level of biosecurity measures is also very important, and one of the sectors in which the veterinarians can contribute strongly. You all know that currently the world is going through a lot of flux. FMD was not heard about from the European countries, and now we see the outbreaks happening in Germany, some other countries. We are also seeing the H5N1 cases sporadically in many countries. It has uh, it was rather bad in the US, where it has transcended not only from the animals, from the dairy animals to the dogs, cats, and also in a few cases to the human beings. Now, all of this is very important to note, that we have to curb these diseases in the very beginning, and for which it is important that we have the biosecurity measures in place, we have surveillance measures in place, and we have a diagnostic system in place to reduce the spread. I think there are a lot of speakers available in front of you today who would be talking about. Just give me a second, please. I just need to have some water. Just a second. Thank you. So sorry. So I was so similarly on the quarantine system. Many of our veterinarians are engaged in the quarantine facilities. There has to be a very sound system. We do not want to be obstructive, or we don't want to be restrictive. But at the same time, we also need to follow the quarantine measures. So at each point where transmission is possible, we have to be very careful. Several steps have been taken in the past few years, and I'm very happy to be a part of it. For instance, we have taken the initiative of strengthening all our RDDLs and CDDLs through the One Health pandemic fund. Then we are also now looking at a very robust mobile veterinary unit system, where the outreach for treatment has increased, and it's literally at the last mile. We are also taking measures in providing good quality vaccine. The supply of vaccine has been done. Last year was 1 year where both doses of vaccine were given to the animals seamlessly. It was a big challenge. We were not able to provide quality vaccines. Then there were challenges at the state level for its implementation. All of those things have now been taken care of. We have developed the indigenous sex sorted semen with the help of NDDB. We are strengthening our cattle farms. We are strengthening our regional fodder stations. So a lot of work is being done. We should be proud of the work that we do. I would also like to take a minute on the animal welfare activities. In fact, and I plead guilty in this, that while we talk about the animal production systems, the dialogue on animal welfare has been very limited. I think this is also a time when we need to speak about animal welfare. We need to talk about giving good housing facilities for the animals because of the increasing temperatures. This is becoming a very important intervention and we need to take care of it. So, a green housing facility is also important. We also should see that the animals are treated properly. There is no violence against the animals. There are several legislations which have been put in place and they should be strictly followed. Uh, we have a system where we provide for registration of complaints, but we do not really know what action has been taken. So recently, we have at AWBI we have taken a decision that we will have quarterly meetings with the state governments to see what has happened to the cases registered, whether anything is coming out of it or it is just a time pass activity. The other thing on the animal welfare that we are thinking of is that we should be able to identify. We have put in place a system where we can identify good animal welfare organizations and support them in whatever small way that we can. The involvement of the urban local bodies and MOPR is very essential, and we need to do discussion with them as to how we can take care of the animals in the animal shelter, at the same time reducing the nuisance of stray animals. So, friends, a lot of work is to be done. It's an entire value chain from improving the breed to improving productivity, taking care of the health inputs. I'm also very happy to inform you that we have now 32 disease-free compartments also on the poultry side. This will help us in increasing our trade on the table eggs and egg powder with a number of countries in the Europe or Eurasian region. So all of this work is very important. The other side of the spectrum, as far as production is concerned, we want more and more of the products to be done in a formalized fashion, for which the AHIDF and the National Livestock Mission funds are available, so that people can make medium-sized farms or large farms have modern processing plants, so that they get a good price and the consumers get to have a good quality of meat, milk, and eggs. So all of this is very important. So uh, I wish each one of you a lot of success in your careers, and I also wish all the very best to this department, because it is uh, a fact that without all of you, this department would not be able to perform the way it is performing currently. So thank you all very much.
Thank you, ma'am. Thank you very, very much. And on behalf of all the veterinary fraternity of the country and from all of our staff from the department and all the states, we express our sincere thanks to you and for your very encouraging words, guidance, and of course, your speech is always dangerous, I call it, because you say two paragraphs of encouragement, and then you give us some task. So I have already noted down few of things. So I know that when you will come back again, you will be asking us that what happened, what we asked. So we promise you that we will be delivering at our level best, and we'll come up to your expectation. So thank you again, ma'am. If you want to be with us, that would be so nice, but I think it is a very odd time. It is already going to be the midnight. So it's up to you, ma'am. I cannot say that you go away. We cannot say that.
Thank you so
Thank
much.
you, ma'am.
It is
Thank
12
you.
o'clock and it
I think
is
we need another
my,
clap for you, ma'am.
no, thank you. And I'm also just reached, so jet lag is catching up very badly.
Yeah, I can understand that.
So I will take leave. Thank you all
Thank
very
you, ma'am.
much.
Thank you. Thank you, ma'am.
Yeah. Thank you so much. I think we continue with the scheduled program. We already had 2 lectures and nice lecture from Dr. Tosh, especially with regard to the avian influenza. The point, which I would like to again reiterate that, he was trying to make it that it's not the vaccination that is the ultimate thing. The other things are equally important. I think there is a message that he was trying to make it. And now I'll invite the last speaker, Dr. Saket Kulkarni. He is the Joint Director at the NCDC, the topic on integrated disease. Sorry? Yeah, integrated disease surveillance program, sharing the zoonotic disease information. Dr. Sanket, 15 minutes is okay?
Yes.
Yeah, okay. Yeah. Thank you so much.
Good afternoon, everyone. So, I think so I'm the odd man out among the veterinarians on the World Veterinary Day. But I would like to thank the chair here because sir invited me for giving this and it's a very good initiative, or you can call as a One Health initiative on the World Veterinary Day. Wishing you all the best on this day. And coming down to the Integrated Disease Surveillance Program, this is a program with respect, I am speaking as a part of human health. So this is a national health program, which is a program which is started in 2004, that is almost 2 decades up, and since 2021 we have changed our reporting system from the hard copy based, as it is there with the animal husbandry as of now in many of the cases. We are changed from the hard copy based system to a real time web enabled system, which has integrated analytics, etc., GIS enabled, and it gives us the automated analytics also. So we have changed into this system, which is, I think so many of you might have seen during many of the workshops where we have integrated platforms. So just to give you an idea what are our objectives, like we deal with mainly detection of the early warning trends or early warning signals. So just to give you what does that mean. For example, how many of you had COVID, including me? So all of you had almost COVID? Okay. First wave or second wave, if I ask this one? Second. Anyone from the first wave? Yes, first. They are there. Why I asked you this one is, see, mortality rate, when we talk about the mortality rate, everyone in India says second wave was the most dangerous one, right? I hope so all of you agree. But does it hold good to the entire globe? I don't think so, right? first wave, we saw maximum mortality in some of the countries. I hope so. You are agreeing? So some of the countries had lot of mortality in the first wave itself. So that virus, it behaves differently in different populations. One has to understand this concept, very, very important. Why I said this one is, just now we heard Dr. Tosh sir regarding the highly pathogenic avian influenza and low pathogenic avian influenza. I hope so all of you are well versed with this. But highly pathogenic and low pathogenic are for the birds, not for the human beings. Please understand this one. For a human being, that virus may act in any way. That means like COVID, what I said to you, for the first wave, many countries faced lot of mortality. This LPAI may also cause lot of mortality. I am saying you this one, among human beings. So the important is early detection and early notification to the responsible department is very, very essential. This is what is the early warning signal. That detection, we are working on that. Second is the public health action, to initiate immediate public health action. So we have formed so many things, sir also mentioned, that is National Joint Outbreak Response Team, which we have established. And it is ongoing with respect to the mainly these kind of viruses. Third is the involvement of, to reduce the mortality and morbidity, and how we are getting these reports. We have 3 forms, actually 4 now. The yes form, which is coming from the ANMs. P form is coming from the doctors, that is a probable disease, probable diagnosis. Then lab is the L form. Recently, last year, our Honorable HFM sir had launched the community reporting tool. I have given you the link. Through this, any person across India can report if there is an unusual event. That means he can, in the bird death also he can report. Let them report. Try this out. Let them report. See, even it may be Ranikhet disease, it may be anything for you. But let them report what is happening in the field, so that early diagnosis will help you also, it will help us also to prevent the virus which can jump from species to species. So we have this community reporting tool, and the moment it gets reported, it goes to what is called as district surveillance unit. In all the districts across the country, we have a district surveillance unit which is manned by a district surveillance officer from the state health government. He is a regular officer, and he is assisted with the 3 contractual employees, wherein they take the actions. That is, they go to the field, verify that information, and if required, collect some of the samples and send for testing. Recently, we had one case of avian influenza in Andhra Pradesh. I hope so all of you are aware of the situation. It's a 2-year-old kid. How can a 2-year-old child get the infection without being in contact? There was an article, newspaper saying that she ate the raw chicken. I say it is not the source. It is not the source. The source cannot be, because the gastric acid is so much, every virus will get damaged. So it is not by eating, it is by something else which has occurred there, which your department will help us, because until and unless that department takes those initiatives and help us to identify the source, how did it come, the science will not grow and we cannot prevent it. So the prevention aspect is very, very important. As Madam was saying, ASF, they don't have vaccination. It is the only thing is biosecurity measures. Here also the same thing. I am speaking the same thing here. So the importance of biosecurity and biosafety measures implemented across all levels and to find the source is very, very important. So we deal with almost, you can see here, we deal with almost 52 disease conditions, including many of them are zoonotic in nature. Those which are marked in red, we deal with those diseases also. So there are some national programs like snake envenoming program and others, a national rabies control program, which are separate, they are dealt separately, vertically. Prevention and control of leptospirosis, etc. We do the surveillance of majority of these things. Giving you the idea of how many of these outbreaks have been reported across the country in last 3 years. See, out of the number is growing from 2022 onwards. You can see because of the COVID, there was a rapid decline. But however, in the last 3 years, if you see the numbers of total outbreaks, which is marked as N in the main head column, you see 1027 to 1862. Now it has, last year we have reached up to 3000 outbreaks. And among them, these are the zoonotic in origin which have been reported across the country. So when we take the top 5 among them, if you see the top 5 diseases, majority of them, for example, the human rabies in the last few years, leptospirosis, scrub typhus, typhoid. Typhoid is emerging like anything. I think so. If you see our dashboard, it's the major thing right now is the typhoid, we don't know, because that bacteria itself is such that very, very highly antimicrobial resistance. We are getting the strains which are very, very highly resistant. Recently we had, I cannot mention where, there are 4 cases which were imipenem resistant. I hope so you all know what does that mean. So use of antibiotics is one more strategy which is very, very important, because it is not that we are dealing with animal sector, we are dealing with agriculture sector, we don't inform, because we are all human beings. We all get affected due to some or the other viruses or bacteria in the field, because we are also human beings, we are social animal, and we may get this. So one has to understand the importance of reporting. What are the major factors contributing to emergence? I am not going in detail here because everyone knows the rapid globalization, unprecedented growth, frequent contact with the animal sector, wildlife sector, etc. Sir mentioned regarding the recent spillover in Nagpur, that is H5N1 spilling to tigers, leopards, cats in Madhya Pradesh. That's usually, I hope so, many of you also might have pets, right? So we don't know whether it is a zoonosis. The other way also may be possible, reverse zoonosis. Why can't we think the other way around? That is also possible. So those things also need to be kept in mind. So when we see, for example, I have taken an example of leptospirosis. What happens? We are seeing now, because of the climate change, many of this we have the rapid rainfall and frequent flooding in various areas, and leptospirosis has been diagnosed. Initially, we used to say in the coastal areas and flash flood areas, etc. Now, last 3 years, when I am seeing the data, we are seeing the leptospirosis cases not only in those areas, but in those areas where we are seeing drought, like it was found even in Maharashtra in the Vidarbha region. You can imagine the temperature and still the leptospirosis positivity. It is not that it is not there. It is only thing is what we are suspecting and what we are providing for laboratory diagnosis. That is very, very important. So intersectoral coordination is very, very important, and we have seen globally also 75% of the outbreaks are zoonotic in origin. In India also, I showed you last 3 years data, we are seeing maximum number of zoonotic origin diseases. One has to keep an eye, ear open for the same, so that your own counterparts have a meeting at the district level, state level, your health counterparts. There are zoonotic committees which have been formed across all the states and districts. So just go and attend and share the information what is happening across the sector. You will hear what is happening in the human health sector, what is happening in the you can share your findings. Accordingly, just progress made so far. We, as sir also mentioned, we have a National One Health Mission, which has been established under the Principal Scientific Advisor to PMO sir. And National One Health Institute has been established in Nagpur, which is working. Then we have Vishanu Yuddha Abhyas was conducted in one state, and we are planning out in the other, very soon. So these are some of the important activities so that we all get coordinated. Many challenges are still, sir, two. Sir, so challenges like controlling of the zoonotic disease poses a multifaceted global challenge as of now. As I mentioned recently also, that with learnings from COVID should be taken and they should be implemented with truth in the field. That is very, very important. You may say LPI, you may say HPI, I don't worry. But what happens to human beings, you may not understand. How that human being reacts to each of those antigens, it may be different from, even different for different people also. So that is very, in spite, you might have seen in COVID, one person may had severe COVID infection, other person with the same, in the same family might not have got even COVID also. Even he was taking care of that person. So these are very, very important aspects which needs to be worked out. So way forward, building trust among various sectors is one of the very important component. Building trust is very essential. That's what I am saying. Go and attend in various aspects. Today also, I just could not resist here because sir requested and I came here to attend and learn. I always learn from what is happening in the other sector so that how can we improve ourselves. We had shared our user credentials, that is IDSP, IHIP user credentials with the Department of Animal Husbandry so that they can view the real-time data, what is happening across the districts to the district level, which diseases are circulating, what is circulating on a real-time basis, that is available with the Animal Husbandry Department. I think so the same we are working out with the Animal Husbandry Department in coming this one so that we can have the same picture here so that we all coordinate and have a better control over the diseases in future. This is all I want to say. Thank you.
Thank you, Dr. Sankit. Wonderful presentation. You started with talking about COVID. I think I luckily didn't have the COVID outbreak. I don't know whether I had or not, but really there is no specific symptom, in between taken so much of precautions. And he also mentioned that, in the first wave and what happened and the second wave, I think there is a distinct difference between the first wave. I think what we have seen is mostly a lot of elderly people, succumb to the infection. And in the second wave, we have seen it is almost around the mid, 30 to 40 years people. So as far as the disease is concerned, obviously we have the person-to-person variation and their genetic makeup and so many things. So once again, on behalf of all of us, I think Dr. Sankit definitely needs a big round of applause, and thank you so much for. So what now? I don't know. We have another 20 minutes. Okay, 20 minutes. So. Okay, fine. So we have 10 minutes. Correct. So sure. So effectively, I think we have 10 minutes. I would like to invite our senior colleague to say a few words, and I will take another couple of minutes for that. And before that, I think if you have any questions on all the three presentations, you can just raise your hands, and because it should not be something like a one-way traffic. So there were three presentations, one on the ethno-veterinary and other on the specifically on avian influenza by Dr. Tosh, and now Dr. Sanket. So if you have any questions, you can just raise your hand and switch on the mic and be precise and spot on. Don't give any preamble so that we can take a few questions and before we ask Dr. Devenderji for his address. Anybody? Yeah, please. Just introduce yourself and spot on and just mention like whom do you want to ask, whether it's Dr. Tosh or Dr. Sinhaji or Dr. Sanket. Yeah.
I am Dr. Ravi Shankar Kapoor, Regional Director, Jharkhand. I want to ask one question from Dr. Sinha sir about Jan Aushadhi. क्या इन जन औषधि जेनेरिक दवाओं को जेम पोर्टल पर डाला जा सकता है ताकि सरकारी खरीद के दौरान उस प्रकार की दवाएं जो किसानों के लिए लाभप्रद होंगी वो दिखे और सरकारी खरीद हो सके? सिर्फ यही सवाल है।
थैंक यू सिन्हा साहब।
देखिए, सबसे पहले तो ये बता दें कि वो जो जन औषधि जो है वो जन औषधि और पशु औषधि में अंतर है। पशु औषधि का हम लोग अभी बात कर रहे थे, लेकिन वो उसी तर्ज पे है। लेकिन पशु औषधि में क्या है कि सेल होगा जेनरिक मेडिसिन का, और वो जेनरिक मेडिसिन ही होगा जो एक चैनल से PMBI जो है, जन औषधि में भी PMBI के थ्रू जाता है और 180 मेडिसिन रहते हैं। और इधर से जो हम लोग का पशु औषधि केंद्र जो होगा उसमें भी हम लोगों ने अभी सोचा है कि 50 औषधि जो जेनरिक रहेंगे उसको एक एक्सपर्ट्स जो हैं वो उसको करेंगे, और वो कहीं भी सेल परचेज उसको जो परचेज करना है उसी चैनल से करेगा। जो भी उसको जो आउटलेट जो रहेगा PMKSK या कोऑपरेटिव सोसाइटी के थ्रू वो उसी चैनल से लेगा। इसलिए इसको आप बोलिए कि जो रिस्पॉन्सिबिलिटी परचेज की है वो PMBI पे है, एंड दैट इज ए स्टैंडर्ड ऑर्गेनाइजेशन फॉर दिस, एंड सो स्टेट इज नॉट इन्वॉल्व इन परचेजिंग दिस एज फार एज दिस अरेंजमेंट इज कंसर्न। ठीक है, और बाकी आपको गाइडलाइंस जब आ जाएगा तो आप उसके थ्रू जा सकते हो।
Thank you. Anybody else? Decide. I think there are no questions. I think one more round of applause for all the speakers. Saab and Dr. Sanket. Maybe now I'll request Dr. Devendra ji for his address.
Good afternoon, everybody. First of all, a very happy World Veterinary Day to all of you. On the web also, and those who all are present here in the house. Let us celebrate the spirit of veterinarianism in us and be true to our motto, the Pusa Seva Asmakam Dharma. Our main job is to serve the animal kingdom, whatever form they are. In today's session, in this technical session, we had 3 lead speakers. First was Sri Uma Shankarji, who spoke on Jan Aushadhi, Pasu Aushadhi, and how this platform is going to serve the animal kingdom or the veterinary world. This is on the pattern of almost Jan Aushadhi Kendra, Prime Minister Jan Aushadhi Kendra. We will have the soaps across the Indian platform. Pasu Aushadhi soaps, they will be generic medicines only, and they will be cheaper enough. In fact, a big impediment to the veterinary profession is the cost of treatment vis-a-vis the cost of animal. Because in case of human being, the emotional value is more. However, in case of animals, the price tag is attached with every animal. My horse is of this price, my cattle is of this price. And when the price of your treatment, the cost of treatment exceeds the price of the animal, then the excellence takes a back seat. So probably with this platform, we can excel better and the profession will grow much at a much higher speed or may escalate to new heights. The second was Dr. Tos, who spoke on avian influenza. We all know in India, every alternate year there is an epidemic. Rather, to be precise, it is a zoonotic-borne epidemic. If you see the chronology, every second or third year, one disease is coming, it is going away, it is being contained. Many a time it has gone beyond the control, like COVID-19, it has gone beyond the control. Recently, we had Congo fever, avian influenza, H1N1, too many diseases. Every alternate year, we are having a zoonotic-borne disease. This is a very big cause of concern for the government as well as for we all policymaker, and of course NCDC also. Dr. Sanket spoke a lot about it. I'm sure you are aware that India is having only 2.4% of geographical mass of the world. But our population is almost, human population is 17% and animal population is 15% of the world. The avian population is more, added to it is almost 7.5% of the world. So much of biology has intertransmissibility of the disease is just concentrated on 2.4% of the landmass of the world. So it is a cause of concern for everybody. How to overcome this situation and how to reduce the burden of disease in our population. Other day I was listening to Chairman Nitin Ayog in a meeting. So government prime agenda is to maintain the health of animals so that longevity of the life of every Indian is increased. And people are secure about their health, they can perform better in sectors. That will lead to prosperity of the country. But until unless we cut the disease at the ground level, means we prevent the occurrence of disease. Here main aspect is health versus treatment. If we cut the disease at the origin level, then it will be leading to an economic control of the disease. And that is where we veterinarians has a great role. Because all epidemics, rather 70% of disease are originating from animals. And if you see the wildlife and avian world also in this and plant world, then I think 80% of disease are coming out of these aspects only. So there is a requirement of, as Dr. Sanket has told, we need to have a network of surveillance, network of labs having surveillance activities and all that. So we have to be very proactive and we have to have our surveillance network and disease reporting at a very high level at the government level. Anyways, thank you very much for all the veterinarians coming here and let us enjoy the World Veterinary Day. Thank you.
Thank you very much. And I think ultimately I have only 2 minutes to speak, and so let me take this opportunity to congratulate all of you and best wishes on the World Veterinary Day. And we all grew up as veterinarians, and our teachers always mentioned that the veterinarian is the best doctor in the world because he cannot ask his patient what is the problem. So that way we're extremely proud of our profession. And let me also admit here that veterinary is not only the treatment. Veterinary also includes nutrition, the genetics, breeding, and of course the health. And as you know that the livestock sector is almost around 18 lakh something around 20 lakh crore is the total value of the livestock sector. And in that, the milk alone, around 16 lakh crore. So it's a huge contribution to not only to the national GDP, but also to the agriculture GDP. And 2030 and 2047, the forecast is around 300 million metric tons and around 600 million metric tons. And we have to contribute a lot for this, and veterinarian will play a significant role in view of the climate change and antimicrobial resistance and the dilution of the genetic resources. And I think all of us know that our role are very much appreciated all over the world, and the One Health concept also has brought all of us on the same dais, whether it is the human health or the animal health or it is the environmental health. So integration, which I was also talking to Dr. Devinderji in the morning, that we do a lot of work, and at some point of time, the convergence is the one which is a bit of a missing link. So as we can work in a team, the animal health, the human health, as well as the animal health, if there is a proper convergence, I think it is the synergetic effect for all of us, the overall output will be much, much better. So with this message, once again, I would like to thank the Animal Husbandry Department for organizing a wonderful function. And once again, thanks for all the three speakers for delivering the excellent lectures. And wish you all, again, a very happy World Veterinary Day. And let us hope that the veterinarians are recognized and their contributions are recognized. And veterinarians are always given the credit which we truly deserve. So with this, I'll once again hand over back to Dr. Adraj for the future. Thank you so much.
Thank you so much, sir. And thank you to all the panelists as well as the co-chairs for the program. So now let's take a break from the lectures and engage our minds a bit for the healthy competition. So as you all know, in the agenda, we have got a quiz. Sir, it is okay.
We'll sit here on
Yes, sir, you can use the...
Minister is...
Sir, we have 10 minutes.
Okay.
So let's have a this quiz on exciting way to test your knowledge on animal health, zoonosis, and the veterinary science. So for that, I request Dr. Vikram Basist from FAO India and Dr. Mansa to carry this quiz.
So good afternoon all. The dignitaries on the dais and delegates from states and all the institutes from throughout the country. So this is a very short quiz and basically around 15 questions for which you will get 30 seconds for each. So in this quiz, it is an incentive-based quiz for which you will get a first prize of round the world ticket to Rome. Sorry, I was joking. So, and you will have 4 options for each questions. The options will only be displayed on the screen. That will not be displayed on your mobile phone. So I request you to take out your mobile phone. There are 2 options. Either you scan the QR code or go to cohort.it. It is already written there, KAHOOT, cohort.it, and use the code there. Or you can directly scan it. It will take you directly to the site. So as you see on the screen, many people have already logged in now. You can add your initials, like starting from if it is Vikram, you can type VIK or anything. That is just initials of yours. And you will find yourself on the screen. So once this is populated, we will start the screen and start the quiz. Please be mindful that it will be only 30 seconds you will get to see the options. The options will only be displayed on the screen and not on your mobile phone. So you will have only 4 shapes and colors. So there has to be a hand-eye coordination to answer the questions. So it's a test of both of your hand-eye coordination and your memory. Dr. Manasa, how many participants have already? Wonderful. Yeah. So once you are registered, once we start the quiz, it will take you to the screen. Just hang on. So maybe if all have registered, or anybody who is unable to register, please raise your hand. Anybody unable? Okay.
Do you have any helpline?
Helpline. I am the helpline.
No, for answering, not now.
So should we start? Okay, we'll wait till 100. Okay. Hello. How many, Adhiraj? How many? Oh, two more. So maybe I can also register? No. Adhiraj, you register. You register. हाँ. हो गया? Good. So Manasa, I would request you to please start the quiz. So this is the theme, and now we are starting the quiz. The options would appear on the screen, and you click on your mobile phone the right option. The key here is the fastest finger wins the quiz. So, okay, the next please. Next please. Next. So here the person with GS is the leading. The initials with GS is leading. Yeah, Singh Saab, good going. The person with the fastest finger wins.
Hello. Hold it, uncle.
You can also see the right options. So Dr. Amit Pal has already surpassed GS. Next, please. Vaccination against which disease are covered with 100% central assistance? So Dr. Nath has surpassed. Okay, next please. The World Organization for Animal Health, formerly known as OIE, primarily focuses on these things. Actually, you're not playing. Next. So Dr. Deepak Barua has already leading now, till now. Next, please. How many RDDLs are operational in India under DHT? Good. So Deepak Barua is still leading. Next, please. So DHT works in collaboration with which? Okay. So Dr. Deepak still continues as a leader. The next is an integrated OH surveillance team. The field veterinarian contributes primarily by good, most of them. Good. Next, please. Which task would typically fall outside a lab technician's duties in a veterinary setting? Okay, so we have next. Under the NLM, which of the following is encouraged to improve livestock productivity? Okay, good. Next, please. So we have last 6 questions coming up. The global initiative that aligns veterinary roles with health security is called? Next. So Dr. Deepak is not letting anybody surpass. Good, good. In India, One Health framework, veterinarians are expected to collaborate with. Very little margin. Last 4 questions. Why is communication important in veterinary teamwork? Next. Next, please. So what is one main goal of teamwork in veterinary practice? Next. Only 2 questions. Last 2 questions. How can livestock owners be part of the animal health care team? Good. So maybe there is nobody to surpass Deepak. And the last question, maybe you have last chance. The Department of Animal Husbandry became a separate department under the Ministry of Fisheries, AH&D. In which year? I'll play. So maybe, so we. So thank you everybody. So we have a clear winner with a very less margin, Dr. Deepak Berua. Yeah, please stand up, sir. With a show of hands. Then the second is with the initials of SN Vet. Oh, great. And third is Dr. Puneet. Dr. Puneet? John Nylon. Okay, great, great. So Dr. Puneet, congratulations. And thank you for your time, and let's hear it from our organizers now. Thank you.
Good afternoon once again. So we are, in the morning we completed the technical session. Now it's the concluding session and we have with us our chief guest, Honorable Minister of State, Professor S.P. Singh Baghel Sahab. Along with sir, we have other guests in the dais, Dr. Abhijit Mitra, Animal Husbandry Commissioner, Madam Barsha Joshi, Additional Secretary, Cattle and IT, Sri Ramshankar Sinha sir, Additional Secretary, Livestock Health, Major General Devender Kumar, Director General RVS, Dr. Raghavendra Bhatta, Deputy Director General Animal Sciences, and Dr. Suparna Sarma Pachuri Madam, Joint Secretary Admin. So we warmly welcome each of you and thank you for joining us for this concluding session. Sir, today we are celebrating the World Veterinary Day, and just to highlight that the World Veterinary Association has decided that the last Saturday of April of every year is considered is to be declared or celebrated as the World Veterinary Day. So we have gathered here. So just before we start our proceedings today, I request everyone to please rise and observe 1 minute silence in solemn remembrance of those who lost their lives in the recent terrorist attack in Pahalgam. Let us stand united in silence as a mark of our deep respect and shared sorrow. Thank you all. May their souls rest in peace and may strength be with their families. Thank you. To set the tone of the valedictory session and to reflect on this year's theme, that is Animal Health Takes a Team, I would like to invite Dr. Abhijit Mitra, Animal Husbandry Commissioner, sir, to deliver the opening remarks and present an overview of the theme of this session. Thank you.
Namaskar. Most Honorable Chief Guest of today's session, Professor S.P. Singh Bagelji, Honorable Minister of State for Ministry of Fisheries and Animal Husbandry and Dairying, as well as Panchayati Raj. My fellow colleague, Ms. Barsha Joshi ji, Mr. Sinha ji, Pachori Madam, colleague from ICR, Dr. Bhatta, DDG Animal Science, DG RVS, Dr. Devendra Kumar ji, Dr. Adhiraj, and all my fellow veterinarians, esteemed colleagues, ladies and gentlemen. This is a momentous occasion where we are celebrating World Veterinary Day 2025. Oh, I seek an apology. I also have from the online, Dr. Thanawat, who is a Assistant Director General and Chief Veterinary Officer of FAO. Dr. Thanawat, welcome to you also. This is I must congratulate each one of you who is a veterinarian and also not veterinarian but connected to this noble profession. All the paraveterinarians, animal health workers, veterinary students, allied professionals, and each one of you in one or the other way, directly or indirectly, linked with this noble profession. This year's theme is the Animal Health Takes a Team. Reminds us that veterinary service is not a solo profession. It is not a solitary pursuit. It is a multidisciplinary mission from the field veterinarian to the livestock inspector, to the researchers, epidemiologists, breeders, lab technicians, policy planners, and technologists. Each role is indispensable in safeguarding the animal health, and though through it, our national health, nutritional security, and biosecurity. India is the livestock capital of the world. We are home about nearly 530 million livestock, 850 million poultry, and if we sum it up, it exactly become the same like 1.4 billion human population. So it is just similar number of animal and poultry along with the human population. India ranks first in the global milk production with 25%, nearly 25% of the global milk production is produced by this country. This sector is highly feminized. 65% of the total workforce are women. It not only contributes to the 30% of the agricultural GDP, but it also contributes 200 million livelihoods, and it connects 9 of 17 SDGs, right from hunger to other things, this profession. In the past year alone, sir, I would like to draw your attention. We have done more than 115 crore FMD vaccination, 405.7 crore of brucellosis under the National Animal Disease Control Program or Livestock LSDCP program. We are also gearing up for the creating FMD-free zone, and India became the first country and only country to secure dedicated support from the G20 Pandemic Fund. Out of 180 projects, we got 25 million US dollar grant money for historic recognition of our One Health commitment. And this is the only project in the world which is exclusively dedicated for animal health. We also launched the standard veterinary treatment guidelines and many other guidelines like crisis management plan, prioritization of diseases, so on and so forth. We have a huge network of laboratory network. I'm not going to detail all that. But our main challenge is that, as our Secretary Madam also was telling, that there is a need to create much more robust surveillance network, strengthen our sentinel surveillance, engage ourselves in the environmental and genomic surveillance so that we can have a system for early warning. That is one of the objectives of this pandemic fund project. It is true One Health spirit that our veterinarians today are also public health protectors, and recognizing the whole theme that it takes a team. That is the reason you must have seen in our technical session, we invited the people from the policymaker, Mr. Sinha, who told us about the what are the importance of generic veterinary medicines, how we are going to be launched. We have an expert who worked on avian influenza from Nishad, Dr. Tosh, and also we had an expert from human doctor from NCDC, Dr. Sanket, who told us about the surveillance network has been done in the human system in a IDSP. Preventing zoonotic transmission, diseases like rabies, brucellosis, and avian influenza is our mandate. We also doing antimicrobial stewardship and collaborating with human health and environmental sector to forecast and contain the outbreaks. Let us also affirm or reaffirm ethical core of our profession, that is animal welfare. Besides the pleasant duty of Animal Husbandry Commissioner and Chief Veterinary Officer of the country, I also have a responsibility to act as a chairman of Animal Welfare Board. So as a chairman of the Animal Welfare Board, I stress that human treatment of animals, whether on farms or in laboratories, in markets or in streets, must be foundational principle of every health system. Healthier animals mean safer food, better livelihood, and stronger communities. To the young generation of the veterinarians, you are the future. Step forward, not just as clinicians, but as innovators, communicators, and nation builders. We need your digital fluency, your scientific insight, and your compassion. As we move ahead, our focus must include climate-smart livestock system to counter rising heat stress and vector-borne disease threats, digital integration from AI-powered diagnostics to televeterinary platforms, capacity building and deep cross-sectoral collaboration across states, institutes, and discipline. Late World Veterinary Day 2025 mark a renewed national pledge to work together, collaborate deeply, and deliver on the promise that every healthy animal strengthens the healthy nation. Jai Hind, Jai Bharat, Jai Pashupalan, Jai Vigyan.
Thank you so much, sir, for for inspiring us with your vision and reinforcing the spirit of collaboration that underpins our veterinary ecosystem. Now I have the honor to request our esteemed guest of honor who has joined from the FAO headquarters at Rome. He is Dr. Thanavat Tensin. He is the Assistant Director General as well as the Chief Veterinarian at FAO. Sir, kindly address the gatherings.
Thank you very much. Namaste. Good afternoon, Honorable Ministers of State for Fishery, Animal Husbandry, and Dairying, and Panchayati Raj, Government of India, Madam Secretary, Animal Husbandry Commissioner, distinguished guests, dear colleagues, friends, and my veterinarian fellows. I'm deeply honored to join you today on this important occasion, the National Workshop on Veterinary, World Veterinary Day 2025 in India, under the inspiration theme, Animal Health Takes a Team. I remember very well when I attended the World Dairy Summit organized in India in September 2022. During that time, Honorable Prime Minister Narendra Modi spoke with thousands of audience and participants. India, every animal in India will get vaccination, foot and mouth disease, and others disease, even though all others animal will have good vaccine, high quality of vaccine. And we can see that the leadership of the prime ministers, it really support the important role of veterinarians in India. And on behalf of Food and Agriculture Organization of the United Nations, FAO, and in my capacity as Assistant Director General and Chief Veterinarian at FAO, I wish to extend my heartfelt congratulations to all veterinarians, veterinary paraprofessionals, and partners in India and around the world. Today, we come together to celebrate the vital role of veterinarians in enhancing animal health, providing livelihood, and protecting human health. For truly, the health of animals, people, and the environment are deeply connected. At FAO, we recognize that strong veterinary services are fundamental to achieving food security, poverty reductions, and One Health objective. Veterinarians stand at the front lines from supporting sustainable animal husbandry, ensuring food safety, food security, controlling zoonotic diseases and transboundary animal diseases, to safeguarding biodiversity and ecosystem. The work of all veterinarians is not only about animals, it is about building sustainable and resilient healthy animal, healthy societies, and a healthier planet. In India, as Dr. Mitra mentioned, a country rich with a deep traditional animal agriculture and innovation, and India is the world's largest dairy producing country. The role of veterinarians is even more profound. At FAO, we are proud to work closely with the Ministry and also with the Department of Animal Husbandry and Dairying and other Indian partners, advancing animal health capacity and sustainable animal production across the countries and region. Two initiatives like Sustainable Livestock Transformation Initiative and the Pandemic Fund, as Dr. Mishra mentioned earlier. FAO is supporting countries, including India, to strengthen early warning system, enhance disease surveillance, and improve emergency preparedness and response capacity. We are building the science and evidence-based narratives to highlight and showcase the important roles of animal husbandry and sustainable animal transformation for better production, better nutrition, better environment, and a better life, leaving no one behind. With the theme of today, Animal Health Take a Team. It reminds us that no one can do this work alone. It takes coordinated action across veterinarians, farmers, animal health workers, researchers, policymakers, and community as a whole, at the local, national, and international levels. It is about partnerships, share responsibility, and collective resilience. FAO remains steadfast in our commitment to supporting veterinary capacity development, enhancing disease prevention and control, especially for transboundary animal disease and zoonosis, promoting responsible and sustainable livestock practices, and working under the One Health approach, bridging human, animal, plant, and environmental health sectors. As we celebrate these World Veterinary Days, let us also reaffirm our collective commitment to invest in our veterinary services, to build stronger teams that work hand in hand, and to create a future where animals and humans thrive together in harmony with nature. Ladies and gentlemen, this year FAO is proudly celebrating its 80th anniversary and during the World Food Forum in mid-October. And I warmly invite you to join the World Food Forum in October. But also I take this opportunity to invite you to join us at the Global Conference on Sustainable Livestock Transformation and Global Forum for Animal Feed and Feed Regulators. It just organized 1 week before the World Food Forum during the first week of October. Last but not least, I would like to express my sincere appreciation to the Government of India and the ministries and also the Department of Animal Husbandry and Dairying and Veterinary Council of India, ICAR, and also all other dedicated professionals here today for your leadership and visions for better, healthier animals and also for better and healthier planet. Together we are shaping a better, healthier, and more sustainable world. Thank you very much. Thanyabad.
Thank you so much, sir. We extend our sincere gratitude to you, sir, for your thoughtful address and continued support to animal health efforts across the globe. Thank you, sir. So, sir, during the technical session, we had a online quiz. So during the online quiz, we had 3 winners. So going ahead with the program, I would request our honorable chief guest to kindly hand over the prizes to our winners of the quiz program. So the first prize winner is Dr. Deepak Beura from Animal Husbandry Department. from Animal Husbandry Department, Government of Odisha. The second prize The second prize winner is Dr. Sujit Naik from DAHD, Government of India. So the third prize winner is actually, he was an online participant. He is also from DAHD, Dr. Puneet from Center for Excellence on Animal Health, Bangalore. Thank you, sir. So now it is my honor to invite our respected chief guest, sir, for the 2 days program, Professor S.P. Singh Baghel, sir, Honorable Minister of State for Fisheries, Animal Husbandry and Dairying and Panchayati Raj, to kindly deliver his address.
नेशनल वर्कशॉप ऑन वर्ल्ड वेटनरी डे, जिसकी थीम एनिमल हेल्थ टेक्स ए टीम के इस कार्यक्रम में मंचासीन डॉक्टर अभिजीत मिश्रा, पशुपालन आयुक्त, श्रीमती वर्षा जोशी अपर सचिव, श्री रमाशंकर सिन्हा अपर सचिव, जिनके अभी हम विचार सुन रहे थे, डॉक्टर थनावत चीफ वेटनेरियन FAO, मेजर जनरल देवेंद्र कुमार जी, डॉक्टर राघवेंद्र भट्टा जी, डॉक्टर सुपर्णा शर्मा पचौरी, सभागार में उपस्थित सभी देवी एवं सज्जनों, सबसे पहले मैं पहलगांव में हुए आतंकी हमले की निंदा करते हुए सभी निर्दोष मृतकों के प्रति श्रद्धांजलि अर्पित करता हूँ। ईश्वर उनको अपने श्री चरणों में जगह दे और उनके ही परिवार को नहीं बल्कि पूरे भारत को इस महान दुख को सहने की क्षमता प्रदान करें। प्रधानमंत्री जी के 48 घंटे में लिए गए निर्णयों का भी स्वागत, चाहे वो सिंधु जल की हमारी संधि निरस्त करना अथवा अटारी बॉर्डर जो लैंड पोर्ट है उसको बंद करना, समस्त वीज़ा समाप्त करना, सभी पाक नेशंस को देश छोड़ने के लिए कहना और उच्चायोग से बहुत अधिकारियों की छटनी करना, ये प्रारंभिक निर्णय हैं। हमारे ही विभाग के पंचायती राज के एक बहुत बड़े कार्यक्रम में परसों मधुबनी से प्रधानमंत्री जी का देश को आश्वासन कि आतंकवादियों ने जो अपनी सजा की कल्पना की होगी उससे भी बढ़ के सजा वो पाएंगे। ऐसी उम्मीद करते हैं कि आतंकवाद भारत से समाप्त हो। मैं इंटरनेशनल वर्ल्ड वेटनरी डे की आपको बधाई। थीम बड़ी अच्छी रखी है, एनिमल हेल्थ टेक्स ए टीम। ये टीम है जो चाहे उसमें पशु चिकित्सक हों, पैरावेट्स हों, किसान हों, वैज्ञानिक हों, सार्वजनिक स्वास्थ्य विशेषज्ञ, गैर सरकारी संगठन, आम नागरिक, सभी टीम का हिस्सा है। ये टीम हमें ये भी याद दिलाती है कि ये थीम हमें ये याद दिलाती है कि पशु स्वास्थ्य, मानव स्वास्थ्य और पर्यावरण स्वास्थ्य का आपस में कितना गहरा संबंध है। शायद इसीलिए G20 के दौरान प्रधानमंत्री जी ने वन वर्ल्ड वन हेल्थ की बात कही है, जिसमें आपकी बड़ी भूमिका हो सकती है। भारत की तो पौराणिक परंपरा है पशु कल्याण। मैं शिव परिवार को जब देखता हूँ तो सह अस्तित्व के साथ कैसे एक दूसरे को नुकसान किए हुए रहा जा सकता है। शिव परिवार कोई कवि की कल्पना नहीं है। दुनिया को संदेश हमने देने की कोशिश की है हमारे सनातन ने, कि एक दूसरे का प्रिय भोजन होने के बावजूद शिव परिवार के लोग एक दूसरे का भक्षण नहीं कर रहे। इससे बड़ा मैसेज और कोई विश्व के किसी धर्म ने पारस्परिक सह अस्तित्व, पारस्परिक सहयोग, जियो और जीने दो, मुझे लगता है यहीं से उठाया गया है। भगवान शंकर के नादिया को माँ पार्वती का शेर नहीं खा रहा है। शंकर जी के गले का नाग उनके पुत्र की सवारी गणेश जी के चूहे को नहीं खा रही है, और कार्तिकेय जी का मोर सांप को नहीं खा रहा है। और हम इंसान होके साथ में नहीं रह पा रहे हैं। और हमारे ऐसा नहीं है कि और वाहन नहीं हो सकते थे। मुझे लगता है कि इंसानों द्वारा पशुओं को नुकसान न पहुंचाया जाए, इसलिए उनको धार्मिकता प्रदान की गई। चाहे शंकर जी की सवारी नांदिया हो, माँ की सवारी शेर हो, गणेश जी की सवारी मूसक हो, लक्ष्मी जी का उल्लू हो, विष्णु जी का गरुण हो, या कार्तिकेय जी का मोर हो, अथवा शनि भगवान की सवारी भी पक्षी है, भैरों की सवारी डॉग है। क्या तालमेल है, क्योंकि कहावत है ना, लव मी लव माई डॉग टू। तो भगवान को प्यार करेंगे तो उनके वाहन को नुकसान करेंगे तो ईश्वर नाराज होगा। तो हमारी तो पुरानी अवधारणा है, दुनिया के लोगों को ये समझना चाहिए। पशुपालन पैरेलल इकोनॉमी हमेशा भारत में रही है। मैं हमेशा कहता हूं कि 5 बीघे किसान उतना आर्थिक रूप से संपन्न नहीं हो सकता है 5 बीघे वाला जितना 5 मुर्रा भैंसें किसी के पास है। और सभी के पास अगर छोटी ज़मीन है तो घर के बैकयार्ड और फ्रंट में हमेशा जगह रहती है पशुपालन के लिए। 80 मिलियन से अधिक किसान पशुपालन पर निर्भर हैं। जीडीपी में हमारा बड़ा योगदान है। और पशु चिकित्सक केवल डॉक्टर नहीं बल्कि रोग डिटेक्टिव, ग्रामीण परिवर्तन के संवाहक और सार्वजनिक स्वास्थ्य के संरक्षक हैं। रोगों की पहचान आप करते हैं, रोकथाम करते हैं, वैज्ञानिक प्रजनन और कृत्रिम गर्भाधान से नस्ल सुधार रहे हैं। डेयरी और मांस के उत्पादन में हम दुनिया में अपना स्थान रखते हैं, निर्यात में भी हमारा स्थान है। प्राकृतिक आपदाओं और वैश्विक बीमारियों में आपका बड़ा रोल रहा है। वन हेल्थ दृष्टिकोण हमें हमेशा सोचना पड़ेगा। हाल की वैश्विक महामारियों में जूनोटिक रोगों से क्या प्रभाव पड़ा है, अभी 2 ही साल गुजरे हैं। भारत सरकार ने वन हेल्थ फ्रेमवर्क को अपनाते हुए FAO, WHO, WOAH अंतर्राष्ट्रीय संगठनों के साथ हम लोग मिलकर काम कर रहे हैं। मैं बधाई देना चाहूँगा कि आप लोग आपकी बड़ी भूमिका रिवीज कंट्रोल में ब्रुसेलोसिस, एवियन इन्फ्लुएंजा, लेप्टोस्पाइरोसिस की निगरानी और रोकथाम में आपका बड़ा रोल है। राष्ट्रीय रोग नियंत्रण और टीकाकरण कार्यक्रम जमीन पर दिखाई पड़ रहा है। दुनिया का सबसे बड़ा पशुधन टीकाकरण अभियान भारत चला रहा है। लगभग मैं रोज किसी न किसी गांव में जाता हूं तो पहला सवाल पूछता हूं, FMD की वैक्सीन हुई है क्या? कई बार अन्य चीज़ों में लोग मना करते हैं कि कोई अधिकारी कर्मचारी नहीं आया, लेकिन जब मैं खुरपका मुँह पका के टीकाकरण की बात करता हूं तो एक राय से लोग कहते हैं कि आए थे लोग और करके गए। इसलिए FMD 114.56 करोड़ आप कर चुके हैं, उनको हाँ कहना ही पड़ेगा। वैक्सीन तो यहाँ से गई है ना, तो हमें पता है कितनी कंज्यूम हुई है। ब्रुसेलोसिस 4.57 करोड़, PPR 26.64 करोड़, LSD 27 करोड़, CSF 0.77 करोड़ टीके लग चुके हैं। काश इतनी ही गंभीरता चेचक के साथ शुरू के दिनों में और पोलियो के साथ ह्यूमन में उस समय की जाती, तो हर गांव में एक पोलियो पेशेंट, जो अब तो खैर पोलियो मुक्त हो गया है, लगभग हर गांव में एक बच्चा जो अब जवान हो चुका है, वो इस लापरवाही के कारण दिखाई पड़ता है। मेरे पिताजी की जनरेशन में हर गांव में 2-4 चेचक वाले मिलते थे, जो कुरूप भी हो जाते थे और कई बार रोशनी भी उनकी चली जाती थी। तो जितना शुरू के दिनों में हमने ह्यूमन पे ध्यान नहीं दिया, आज हम उससे ज़्यादा एनिमल पे ध्यान दे रहे हैं। ये भारत की संवेदनशीलता का, सरकारों का परिचय है। अगर तय किया है प्रधानमंत्री जी ने कि FMD मुक्त है, हमें करना है, तो आपकी इस पूरी टीम के बिना संभव ही नहीं है। 2030 तक अगर हम समाप्त कर लेंगे तो दूध और मांस का निर्यात निश्चित तौर से बढ़ जाएगा। इसमें सहायता में 4016 पशु चिकित्सा मोबाइल यूनिट्स हमारे पास हैं। 168 लाख पशुओं की देखभाल और 81 लाख पशुपालकों को आप लाभ प्रदान कर चुके हैं। भारत में दूध की नदियां बहती थीं, वहां पर अभी हो सकता है, या भेड़ाघाट देख के किसी ने कह दिया होगा जबलपुर में, लगभग वो वहाँ संगमरमर के बीच में माँ नर्मदा निकलती हैं तो लगता है दूध की नदी है। ऊपर से चांदनी रात हो तो और भी ज़्यादा लगती है। कब बहती थी समझ में नहीं आया। प्रति व्यक्ति दूध बहुत कुछ ग्राम हुआ करता था, चारागाह ज़्यादा थे, एग्रीकल्चर लैंड ज़्यादा थी। तब भी मैं देखता हूँ कि नदी कब बहती थी। नदी बह रही होती तो द्रोणाचार्य को युद्ध नहीं करना पड़ता, गाय नहीं दी तो युद्ध करना पड़ा। बह सकती हैं, बड़ा छोटा सा फार्मूला है, लेकिन बह सकती है। मैं आंकड़ों में बहुत ज़्यादा अपने भाषण में सम्मिलित नहीं करता हूँ, लेकिन अभी कहाँ के लोग आए थे, हम लोग मिले थे ब्राज़ील से, ब्राज़ील के डेलीगेशन से हम लोग मिले थे। तो मैंने एक सवाल पूछा कि नेचुरल सोर्स से गर्भाधान का प्रतिशत क्या है और आपका AI का प्रतिशत क्या है। तो मुझे अचंभा हुआ कि उन्होंने कहा 0, हम 100% IVF करते हैं। यही दिन मैं देखना चाहता हूँ भारत में। तो मुझे याद आ रहा है कि मैं हर भाषण का मेरा ये अंग होता है। यूजलेस हो गया है बैल, इसलिए वो प्राइसलेस हो गया। प्राइसलेस भी नहीं, माइनस में जा रहा है। मेरे घर के बछड़े को अगर आप ले जाना चाहें तो मैं 500 रुपये और दूंगा कि आप इसको ले जाओ मेरे घर से। मेरे अपने बचपन के अनुभव हैं कि मैंने हर भाषण में इसको कहा है, इतना परिवर्तन अपनी इस उम्र में देख लूंगा, इसका तो अंदाज ही नहीं था कभी। गाय बछड़ा देती थी तो माँ कहती थी बाजार जाओ, बतासे लेके आओ, गांव भर में बांटो, या गुड़ बांटते थे। मिठाई विठाई की तो बात ही नहीं होती गांव में, तो गुड़ और बतासे खुशी में बांटे जाते थे। जिनका बैकग्राउंड देहात होगा तो उन्हें पता होगा, रात में सोहर के गीत ढोलक पे गाए जाते थे बछड़ा पैदा होने पर, जैसे बच्चे के पैदा होने पर। बल्कि लड़की पैदा होने पर सोहर के गीत मैंने कम सुने, लेकिन उस जमाने में बछड़ा पैदा होने पर सोहर के गीत मैंने सुने। किसी त्योहार पर अगर घर में कोई मृत्यु हो जाती थी तो त्योहार खराब माना जाता था, लेकिन बछड़ा पैदा हो जाए तो वो त्योहार उठ जाता था। क्या महत्व था बछड़े का। क्योंकि बैलों से हल चलता था, बैलगाड़ी चलती थी, रहट चलती थी। जब मैं रहट बोला तो मेरे बेटे ने कहा ये क्या होता है, तो मुझे ड्राइंग करके बताना पड़ा कि ऐसे एक बाल्टियाँ होती थी, एक बम होता था, उसको चारों तरफ बैल चलता था, तो आधा पानी आता था, आधा रास्ते में गिरता था। पूरे दिन मैंने एक बार रहट चलाई, मैंने मैं चल गया हूँगा दिन भर में 25 किलोमीटर, लेकिन 1 बीघा खेत की सिंचाई हो पाई थी। अब जैसी ट्यूबवेल चलाते हैं तो 20-30 मिनट में 1 बीघे की, तो पंपिंग सेट और मोटर आई तो हाँ, रहट चलाते थे बैलों से, हल चलाते थे, बैलगाड़ी चलाते थे, और कोल्हू भी बैलों से चलाते थे। और पीछे जाएं तो एक ढेकली भी बैल से चली है, एक पुर भी होता था जो बैल से चलता था, चमड़े के बड़े थैले में पानी निकाला जाता था। पहले बैल इधर आते थे, फिर नीचे जाते थे तो वो ऊपर आता था। मुझे दाएं का भी याद है, गेहूं को काट के बैलों के खुरों से क्रश किया जाता था, और 7 दिन में जाके वो 5-7 कुंटल गेहूं निकलता था, और भूसा 3-4 इंच का होता था, जिससे पशु खाने में बहुत दिक्कत करते थे। अब तो भूसा मलाईदार निकलता है थ्रेसर में, बिल्कुल ऐसे सॉफ्ट। अचानक बुरे दिन शुरू हुए मशीनीकरण के कारण। ट्रैक्टर आया तो हल चला गया। मैंने तो अपनी लोकसभा में पिछले 27 साल से हल चलते हुए नहीं देखा अपनी लोकसभा में। कहीं ईस्ट वेस्ट में चल रहा होगा तो मुझे नहीं पता। ट्रैक्टर ने हल भी खत्म किया और बैलगाड़ी को भी खत्म किया। मुझे याद है 1973 में मैं एक बारात में बैलगाड़ी से गया था, 72 में। वो लास्ट हमने बारात बैलगाड़ी से की। फिर थ्रेसर आया तो दाएं खत्म हो गई, क्रेशर आया तो कोल्हू खत्म हो गया, तो यूजलेस हो गया, इसलिए वो प्राइसलेस हो गया। वो पैदा क्यों हो रहा है, मुझे इस बात पर आपत्ति है। हमारे समय, हम बचपन में जब ये टेक्निक नहीं आई थी सेक्स सॉर्टेड सीमेंट की, तो मजबूरी थी। मुझे याद है कि गाय को बड़ा भाई आगे रस्सी पकड़ता था, पीछे हम डंडा लेके चलते थे, किसी गांव में जाते थे। हाँ भाई, सांड दिखाई पड़ा, सुबह तो दिखाई पड़ा था, पता नहीं, तो उसके फुटप्रिंट को देखते हुए नंदी महाराज को ढूंढते थे। अब जब एआई है, सेक्स सॉर्टेड सीमन है, तब कोई इलाके का बड़ा आदमी अपना आर्थिक नुकसान करते हुए अपने उन्नत किस्म के बछड़े को समाज के लिए सांड बनाता था, और उसको कोई नहीं डंडा मारता था, चाहे वो फसल खाए, रोटी भी मिलती थी और बहुत अच्छी हेल्थ हो जाती थी उसकी। अब लगभग सभी लोगों ने ये पुण्य कमाने का प्रयास किया है। अब ये पाप है। अब जो बिना बधियाकरण के अपने बछड़े को छोड़ रहे हैं, और ये पाप है। सूचना के अधिकार में मांग लो अभी, और मैं मंत्री के रूप में नहीं मांग पा रहा हूँ, कि पिछले 1 साल में कितने सांडों ने आदमियों को मारा है। एक्चुअली एफआईआर सांड के खिलाफ नहीं होती, तो सीधा आंसर नहीं आएगा, लेकिन ये जरूर आएगा कि एक तहरीर देगा ना आदमी कि मेरे पिताजी को सांड ने मार दिया है, लाश वहां रखी है, कृपया पंचायतनामा और पोस्टमार्टम कराएं, तो आ जाएगा आंकड़ा। यूपी में 2 ही साल में मिनिस्टर रहा हूँ, फिर एमपी बन के बीच में आ गया। उस समय हमारे अपने 2 वेटनरी डॉक्टर मरे हैं। वो इलाज करते हुए नहीं मरे, वो स्कूटर से जा रहे थे, 2 सांड लड़ रहे थे, एक उस पर आकर गिरा, मर गया। मुझे उनके घर जाना पड़ा, और मृतक आश्रित में मैंने कहा जितने जल्दी नौकरी दे सको। विभाग अपने विभाग के विधवा को भी चक्कर कटवाता है। जिसके पति ने इस विभाग की सेवा की है, उसका तो 2-3 दिन में काम हो जाना चाहिए, अगर पात्रता रखते हैं तो मुझे सस्पेंड करना पड़ा एक कर्मचारी को, जो मृतक आश्रित की नौकरी देता था। वो योग्यता है तो आप रोक नहीं सकते, और अयोग्य को आप दे नहीं सकते, तो 1 दिन में हाँ अथवा ना कर देना चाहिए। तो मुझे यूपी में सस्पेंड करना पड़ा। टर्मिनेट करने का मन था, लेकिन प्रेशर बहुत था, तो सस्पेंड किया था कि आप अपने ही विभाग के कर्मचारी की विधवा को परेशान कर रहा है। नौकरी शासनादेश से होती है, किसी के रहम पे नहीं होती है, तो उसमें लटकाना नहीं चाहिए। वो विषय मैं ये कह रहा था कि 2 वेटनरी डॉक्टर 2 साल में मैंने, और अपनी कॉन्स्टिट्यूंसी में 2-3 महीने में एक जगह बैठने जाना पड़ता है कि मृत्यु का कारण नंदी महाराज थे। अब ये राज्य सरकारों का काम है। दूध की नदियां बहने से मैंने अपना भाषण शुरू किया था कि यदि AI सेक्स सॉर्टेड सीमन के द्वारा 100% किया जाए तो 3-4 साल में हर किसान के दरवाजे पे एक उन्नत किस्म की बछिया गाय होगी। वो साहिवाल होगी या थारपारकर होगी या हरियाणवी होगी या गिर होगी। और उत्तर प्रदेश में गंगा तीरी को भी हम लोगों ने शामिल किया है, बनारस के आसपास, तो गंगा तीरी होगी। फिर सभी नानियां बनेंगी, वो सभी गायें दादी नहीं बनेंगी। तो दादी बनने से रोका जाए गायों को और उनको नानी ही नानी बनाया जाए। और आजकल मैं देख रहा हूँ छुट्टियां हो गई, सब बच्चे नानी के यहाँ जा रहे हैं, दादी के यहाँ कोई नहीं जा रहा। जिस देखो बच्चे को कहाँ जा रहा है, नानी के यहाँ जा रहा हूँ। हालांकि नानी दादी भी है और दादी नानी भी है। तो यहाँ जब 90% सेक्स सॉर्टेड सीमेन से फीमेल ही पैदा होगी, ये गारंटी है। अब इसका प्रचार प्रसार क्यों नहीं हो रहा? हमारे हजारों करोड़ के प्रोजेक्ट हैं, तो इसमें अगर 1000-2000 करोड़ भी लग जाए तो ये 2 समस्या हल होंगी। एक, दूध की नदी बहेंगी। नंबर 2, वो सड़क सांप सांड के बच्चे नहीं होंगे। वो साहिवाल, गिर, हरियाणवी या थारपारकर की बच्चियाँ होंगी। बच्चियाँ पैदा हुई तो 10-12 साल रहेगी जब तक वो गर्भ धारण करती है। और नंदी महाराज पैदा हो गए तो टोटल पैरासाइट होंगे। एक सेमी पैरासाइट भी होता है ना, तो ये सेमी पैरासाइट नहीं होगा, ये टोटल पैरासाइट होंगे। और दूसरी गलती, राज्य सरकारों को एक चिट्ठी लिखिएगा, मैंने पहले भी अनुरोध किया था कि अव्वल तो वैसे मैं किसानों के साथ हूँ, मेरे पास 5 बीघे ज़मीन है, मैं 2 बैल रखूँ और साल में 2 बार जुताई करनी है 2 फसलों पर, और 365 दिन मुझे बैल को अपने घर पे रखना है। बैल काम करें या ना करें, उन्हें 2 बार सानी खिलानी पड़ेगी और 3 बार पानी पिलाना पड़ेगा। और एग्रीकल्चर में यूज कितना होगा? अब तो स्मॉल होल्डिंग वाले सब लोग हैं। जैसे ही दूसरा बच्चा पैदा होता है ज़मीन आधी हो जाती है। मेरे बाबा की ज़मीन 600 में हो गई, मेरे पिताजी हमारे पिताजी की ज़मीन 600 में हो गई। हम 6 भाई हैं। थोड़े दिनों बाद तो ट्रैक्टर घूम भी नहीं पाया करेगा खेत में, फावड़े से खेती होगी। तो जैसे ही दूसरा बच्चा पैदा होता है ज़मीन आधी हो जाती है, 3 होते ही तिहाई हो जाती है। और ये लड़कियां और मांगने लगें जिनका अधिकार है। ये तो भारत की हमारी बहनें हैं जो 11 रुपए में खुश हो जाती हैं, 21 रुपये, 101। कई बार क्या होता है, बीबी को दिखाते हुए तो 101 देते हैं, लेकिन बाद में 1100 देते हैं। और ये नहीं वो समझती हैं बीबियाँ कि ये अगर भाई कपिल सिब्बल कर ले और बहन सबसे छोटा वाला वकील कर ले तो बहन जीतेगी, क्योंकि कानून है। बापलाई खेती में उसको एक दरखास्त देनी है। हमारा देश कितना महान है कि रक्षाबंधन पे 1100-2100 जिसकी जो हैसियत है, एक साड़ी उसमें खुश हो रही हैं। और जिस दिन एक दरखास्त दे देगी, भाभी पैरों पे गिर पड़ेगी। जिसको बहुत प्रॉब्लम होती है कि तुम क्यों आ गई, तुम ये हो गया वो हो गया, उसको एक तो मैं कहता हूँ दरखास्त जरूर पढ़नी चाहिए, लो या ना लो, अपने अधिकार का बोध कराओ। विषय से हट जाता हूँ बार बार, तो पता नहीं क्या कहना चाह रहा था। तो आज हाँ, बछिया की बात कर रहा था मैं। तो 90% पैदा होंगी, अच्छी किस्म की पैदा होंगी। हाँ, जब एक ये लिखिएगा कि जब हम FMD करने जाते ही हैं साल में 2 बार, तो जो बछड़े मिले हैं उनको बधिया करके आए। उसका प्रभाव ये होगा कि एक वो छोड़ भी देगा किसान, तो वो एग्रेसिव नहीं होगा। मैंने देखा कि हम लोग क्यों बधिया करके बैल को हल में यूज करते थे या बैलगाड़ी में, क्योंकि वो बहुत फिर गुस्से में नहीं होता था। और अगर सांड से खेती की जा सकती थी तो बेकार हम लोग बधिया करते थे, फिर तो सांड से हम लोग हल चलाते तो बैलगाड़ी का अता पता भी नहीं चलता वो कहाँ ले जाता। यूपी में तो हमने वो एक मशीन भी दी थी, एक वो प्लास टाइप का था, मैंने इशू करवाया था अपने आदेश पर। तो ये जब काम करने जाते हो एफएमडी का, केवल एफएमडी के लिए थोड़े आप गांव जाते हो, बीमार होने पे भी पशु के तो आप जाते हो ना कॉल पे। 1960 है क्या नंबर है जो भी है, हाँ जी 1962, अच्छा मेरे पैदा होने के 2 साल बाद 1962 है। तो उसके लिए भी आप जाते हैं तो थोड़ा तो सोशल रिस्पॉन्सिबिलिटी निभानी पड़ेगी कि पूछ लो इस समय गांव में छोटे बछड़े जो भी उम्र में कर पाते हो उसको करके आइएगा, कुछ गुड़ ढीला कुछ बनिया ढीला। मुझे नहीं आता, मेरे गांव में कभी बधियाकरण करने के लिए डॉक्टर आता था, गांव के लोग कर लेते थे, जो वो खुद जानते हैं वो नहीं कर रहे हैं। मैं कह रहा था मैं किसान के साथ हूँ, क्योंकि जमीन कम है, 2 बैल रखेंगे तो 365 दिन खिलाना पड़ेगा, और जब ट्रैक्टर बुलाएंगे तो उतना ही पैसा देना होगा जिस दिन ट्रैक्टर चलेगा। या मेरा ट्रैक्टर है तो डीजल उसी दिन वो पिएगा जिस दिन चलेगा। बैल चलें या ना चलें वो भोजन करेंगे। अब नैतिक पतन हो गया तो कुछ बचेगा नहीं। मुझे याद है 8 साल हमारे बैलों ने हमारे घर में काम किया, हमें मालदार भी बनाया। फिर एक दिन वो अशक्त हो गए, ना मर रहे थे ना काम कर पा रहे थे। आज का युग होता तो क्या होता। ऐसा पीरियड इंसान हो या जानवर हो 2-3 साल होता है हम लोगों में भी, कि ना मर रहे हैं और ना हम हार्डवर्क कर पा रहे हैं। तो क्या किया जाए, स्लॉटर हाउस भेजा जाए हम लोगों को। तो हमारे दरवाजे पे 2 बैल थे, मुझे याद है एक हल्का नीला था एक वाइट था। वो उठ भी नहीं पा रहे थे। अगर 2 दिन हम पानी नहीं पिलाते तो डिहाइड्रेशन में वो मर जाते, लेकिन उनको पानी पिलाते थे, वो उठ नहीं पाते थे तो बाल्टी को टेढ़ी करते थे, उनको पुचकारते थे और पानी पिलाते थे। अब सोचिएगा, ये सीन अब मुझे देखने को किसी गांव में नहीं मिल रहा है। और ऐसे लगभग 3 साल भर जिंदा रहते थे, 2-3 महीने तो बिल्कुल बैठाना कहते हैं, जो बैठने उठ ही नहीं पाते थे, लेकिन कसाई को नहीं घुसने दिया गांव में। तब ये बहुत ज़्यादा ये संस्थाएं भी नहीं थी जो आजकल बहुत जागरूक हैं गायों को लेकर के, लेकिन नहीं घुसने देते थे। ये हम भूखे रहते थे, हमारे पास 2 टाइम का खाना नहीं होता था, लेकिन कभी गौवंश को कभी स्लॉटरिंग के लिए किसी ने अलाउ नहीं किया। तो मैं किसान के साथ हूँ, क्यों ना छोड़े वो। गाय की गैंग अपनी भूख की लड़ाई लड़ रही है और किसान अपने बच्चों की भूख की लड़ाई लड़ रहा है। गर्मियाँ आ गई हैं, ठंड में रात भर जग करके किसानों ने अपनी फसल की रक्षा की है। आप जब बाइकार जाते होंगे तो खेतों की बाउंड्री आजकल बनी है तार से। कभी दिल्ली से साड़ियाँ ले जाते हैं, वो बहुत सस्ती, उनको लगाते हैं। तो बैल भी सब, वो गाय की गैंग समझ गई कि ये तो दिखावटी है। पहले हम खेत में एक बिजूका बनाते थे कि वो चिड़ियों से रक्षा करेगी, आजकल चिड़ियाँ उसके सिर पे बैठती हैं, तो वो हमारा फेल हो गया। बिजूका ही कहते थे ना, ऐसे कुछ कुर्ता पहना के डंडी पे ऊपर मटकी रख देते थे तो पक्षी नहीं आते थे। पक्षी इंटेलिजेंट हो गए, वो उसी की खोपड़ी पर बैठ रहे हैं। फिर मैंने दूसरा प्रयोग देखा कि धोतियों की बाउंड्री बनाते हैं, तो शुरू में जानवर डरे, फिर एक आध उससे उलझ के गिरा, उन्होंने कहा ये तो कुछ भी नहीं है, तो उसमें घुसने लगे। आजकल तारों की हो रही है और वो एनिमल क्रूल्टी एक्ट में आ रहा है, टांग कट रही है। वो चाइना के थे, उस पर भी एक लेटर लिखिएगा कि ये जहाँ पाए जाएं तो उन पर कार्रवाई की जाए। अब इंडो पाक बॉर्डर थोड़े है, परिंदा पर नहीं मारेगा, परिंदा वहाँ भी पर मार रहा है। लेकिन किसान एक डंडा, फिर एक पेड़, फिर एक यूकेलिप्टस, फिर ऐसे करके बेचारा कुछ करता है। और वो जो 30-40 गायों को या बछड़ों नंदियों को लेके चलता है, वो उखाड़ देता है उसको। अब कल्पना करिए आपके पास 2 बीघे ज़मीन आपके हिस्से में, 2 ही फसलें होती हैं, कहीं कहीं 3 होती हैं, और 50 की गैंग 15 मिनट के लिए आपके खेत में घुस जाए तो कुछ बचेगा क्या? भाई मुझे लगा कि आपको आज 26 तारीख है ना, 1 तारीख को तनख्वाह आनी है, किसी की भी सरकार हो, लेकिन फसल थोड़े आनी हो जड़ने के बाद। इसलिए तय कर लीजिएगा, इस पर जितनी शक्ति हो, राज्य सरकारों को एक चिट्ठी लिखिएगा कि कृपया सेक्स सॉर्टेड सीमन के द्वारा एआई कराओ। मैं तो वो दिन देखने के लिए जिंदा रहना चाहता हूँ कि भारत में 100% एम्ब्रियो ट्रांसप्लांट होने लगे। मतलब मेरा बहुत दिल के बहुत करीब है ये सपना। इसलिए मैं अपनी लोकसभा में तो लोगों को, जितना हमारे यहाँ एआई हो रहा है आगरा लोकसभा में, इतना कहीं नहीं हो रहा है, क्योंकि मैं अपने शादी ब्याह भागवत कथा में भी जाता हूँ तो इस पर चर्चा जरूर करता हूँ। धन्यवाद, आप इस मुहिम को आगे ले जाएंगे। और 100 रुपये का है, शायद एनडीडीबी कुछ राज्य सरकारें सब्सिडी दे रही हैं। 300 रुपये, मुझे लगता है 2.5 में गर्भधारण हो जाता होगा, 2.5 का औसत आ जाता है। 3 बार में अगर 300 रुपये में गाय ने गर्भधारण कर लिया और 90% बछिया पैदा हुई, तो पैदा होते ही वो 50,000, 60,000, 70,000, 10,000, 15,000 की हो जाएगी। और नंदी महाराज पैदा हुए तो बस वो इंजेक्शन आ ही गया है जिससे गाय दूध दे देगी, तो उसके लिए भी ज़रूरत नहीं है कि उसको गाय के पास ले जाओ, आजकल तो एक इंजेक्शन लगता है। तो धन्यवाद, आप महत्वपूर्ण विषय पर मैं पढ़ रहा था कि आपने अच्छी चर्चा की है। यूज ऑफ जेनरिक मेडिसिन इन एनिमल हस्बेंड्री सेक्टर, रोल ऑफ वेटरिनरियन इन प्रिवेंटिंग जूनोटिक ट्रांसमिशन ऑफ एवियन इन्फ्लुएंजा, और तीसरा इंटीग्रेटेड डिजीज सर्विलांस प्रोग्राम। तो ये विशेषज्ञों ने जो विचार मंथन के द्वारा जो अमृत निकलेगा वो देश के काम आएगा। प्रधानमंत्री जी के सोच देखिएगा कि हम कृषि विभाग के वटवृक्ष के नीचे घास की तरह उगते रहे और पनप नहीं पाए। वर्षों बाद प्रधानमंत्री जी ने, पहले आदमी हैं जिन्होंने कृषि विभाग से निकाल करके पशुपालन विभाग को, डेयरी को और फिशरी विभाग को अलग किया है। अब हमारे अपने सेक्रेटरी हैं, हमारे अपने मंत्री हैं। मैं तो एक बात और कहता हूँ, ये आईसीआर की तरह इंडियन काउंसिल ऑफ वेटनरी रिसर्च एंड फिशरी रिसर्च भी पता नहीं क्यों नहीं फाइल चला रहे। अरे रिजेक्ट ही तो होगी ना। मैं तो नॉन प्रैक्टिस अलाउंस उत्तर प्रदेश में आपका चला के आया, एनपीए क्यों नहीं होना चाहिए? अरे रिजेक्ट हो तो है, मैं पहला आदमी था जिसने फाइल तो चलाई, और वहाँ रुक जाता तो करा के भी आता। तो नॉन प्रैक्टिस अलाउंस हमारे लोगों को 2 नंबर कम आ जाते हैं सीपीएमटी में या नीट में, तो उसकी सज़ा ज़िंदगी भर भुगतेंगे क्या? फाइनेंशियल, जब तक आप खुश नहीं होंगे तब तक आप दूसरे को खुश नहीं कर सकते। तो मैं तो वहाँ भी चला रहा था, मैं वहाँ 30 रुपये गाय को दे रहे थे, मैं 100 रुपये की फाइल चला के आया। लोग कहते हैं जीने के लिए खाना और खाने के लिए जीने में फ़र्क है। गाय 30 रुपये में नहीं पेट भर सकता। या तो आपके पास इतना पैसा हो कि बैसाख में जब गेहूँ कटते हो तब एक बार में भूसा खरीदें, वो संभव नहीं है। भूसा 3 गुना हो जाता है ऑफ सीजन में। तो 100 रुपये से कम में गाय का पेट नहीं भर सकता है। और भूखी, जब मैं ही देखता हूँ रात में अगर डिनर ना हो तो नींद ही नहीं आती है, कई बार फंस जाते हैं, तो रात में उठ के फ्रिज व्रिज खोलते हैं। तो गाय जिंदाबाद नहीं कर सकती, मुर्दाबाद नहीं कर सकती, इनकलाब जिंदाबाद नहीं कह सकती, काले झंडे नहीं दिखा सकती, धरने पे नहीं बैठ सकती। तो क्या हमें उसके वेलफेयर का ख्याल नहीं रखना एनिमल्स का? इसलिए हमें जो हड़ताल पे नहीं जा सकते हैं, बोल नहीं सकते हैं, उनके कल्याण का भी हमें ख्याल रखना चाहिए। ये एनिमल हस्बेंड्री डिपार्टमेंट के साथ एनिमल वेलफेयर भी इसमें जुड़ना चाहिए। बहुत बहुत धन्यवाद। थैंक यू वेरी मच।
Thank you so much, sir, for appreciating the efforts of the veterinarians in control of animal diseases and for animal welfare activities, as well as reaffirming the government's commitment to animal health and veterinary development. So, to conclude this enriching day, I would like to invite Dr. R.G. Bambal, sir, Secretary, Veterinary Council of India, to propose the vote of thanks.
Good afternoon to all. First of all, I extend my warm wishes and happy World Veterinary Day to all veterinaries in the country on behalf of Veterinary Council of India. Now it's my honor and privilege to extend a vote of thanks on this special occasion of World Veterinary Day, celebrated under theme Animal Health Takes a Team. On behalf of the department, Veterinary Council of India and the entire organizing team, I express my heartfelt gratitude to Honorable Minister of State for Fisheries, Animal Husbandry and Dairying and Panchayat Raj, Professor S.P. Singh Baghel sir, for gracing the function with his august presence in spite of busy schedule and enlightening us by inspiring words that acknowledge the critical role played by the veterinary profession in safeguarding both animal and public health. I extend my sincere thanks also to our Secretary Ma'am. She has joined online from the US in the odd hours and also guided us and gave the path ahead. She has also expected much from the veterinarians. She acknowledged the role of the veterinarians in the development of animal husbandry sector, but also felt that there is a more need to have from the veterinarians in the country. I also thank Dr. Abhijit Mitra, Animal Husbandry Commissioner, for his overall guidance for organizing this program and opening remarks, including the thematic presentation that effectively set the tone for today's proceedings also. I thank Varsha Joshi Ma'am, Additional Secretary, Department of Husbandry and Dairying, for gracing the function and for her continued support to us and leadership in advancing collaborative approaches and even the digitalization in the livestock sector. My appreciation goes to Sri Ramashankar sir, Additional Secretary, Livestock Health, for his informative presentation on the use of generic medicine and for his broader contribution to animal health policies. I thank Pachuri ma'am, she Joint Secretary, Administration in the Department of Husbandry, for her presence in the program. I also express my sincere thanks to Dr. Thanawat Tenzin, Assistant Director General and Chief Veterinarian at the Food and Agriculture Organization FAO, for joining virtually and sharing his global perspective on team-based approaches to veterinary health. I extend my gratitude to Major General Devendra Kumar sir, Director General Remote Veterinary Services, Dr. Raghavendra Bhattasi sir, Deputy Director General Animal Health Science, who also played the role as co-chair during the technical session in the morning, and also guided and valuable support to the veterinary community. I thank the technical session speakers, mainly Dr. Chakradhar Stosh, Principal Scientist from Indian Council of Agriculture Research, ICR Nishad, and Dr. Sanket Kulkarni from NCDC, who have already deliberated in the morning about the role of veterinarians and also the integrated disease surveillance program. I thank all the media, electronic media, PIB coordinator, the quiz participants, because online there are so many officers and field veterinarians joined online also, and the directors of animal husbandry from our department also. Dr. C. Mittal Saab is there, DDG NIC, Director VCI, and all other officers of the department, attendees and the online attendees, then the contributing to the success of the event, and also the most important part, because we have made this program online, and we have also seen so many online participants in the quiz, and I congratulate the prize winners of the quiz also. So I personally think that veterinarian is the first line of defense as far as the animal health risk is concerned and human health is concerned. So today's celebration truly reflected the spirit of collaboration, dedication, and shared responsibility that defines the veterinary profession. So let us work together and carry this momentum forward in the services of animal welfare and public health. Thank you.
Thank you, sir. So we are closing this program. So before the close, we'll have a group photograph, which is arranged just behind this block, and followed by lunch, which is arranged on the ground floor. Thank you.